Dr. Jolly, you want to call us to order real quick?
Yes, sir. So good morning, everyone. Welcome. This is a continuation of our board meeting from yesterday. It's Wednesday, June the 5th. We'll start with a real quick roll call. Dr. Rodney Richmond.
Present.
Dr. Lynn Krause.
Here.
Dr. Lenora Newsom.
Here.
Dr. Debbie Mack.
Here.
Dr. Clint Boone.
Here.
Mr. Harold Simpson.
Here.
Dr. Beth Ann Davenport.
Here.
So we do have a quorum. The full board is here. Turn it over to you, Dr. Kirby.
All right, first up, we have our support group this morning with us. Howard, do you know the order of events for us?
I do not.
All right, so I know we've got a couple of people. All right, I know we've got a couple of them that are online. Ashley, if you want to kick off with that. I see. Leanne, can you hear us? You're on mute right now.
Yes, I can hear you.
There you go. My understanding, Leanne, is that you've got a request to act as a pharmacist in charge.
Yes, sir.
Okay. You want to give the board just a brief overview of kind of where you are in contract status and everything?
Yes, I'll be glad to do that. I have been in the recovery group for 3 years. It was March 14th of this year. And, I have been in recovery for 3 years now, and I feel that I do what it takes every day to stay sober. I talk to my sponsor daily, and I go to meetings, and I just feel that, in this time in recovery, I do feel that I am ready to take on the responsibility of PIC at our care. They're opening up a store in Huntsville. So I feel like I do what I need to do daily to keep sober and to do my job in the appropriate manner to take care of my patients.
And Leanne just mentioned, but there's a new pharmacy opening that she has opportunity to act as PIC. I've talked to their corporate person. They're aware of Leanne's status and are supportive. So we don't have any price about that, but she's here for you guys to request the ability to be a PIC.
So Leanne, are you're at 40 hours a week right now?
Yes, sir.
Okay.
Yeah, technically full time, which could be more than 40, but generally, I think the cap is 50 on that generally.
Yes, sir. And this job does only it's going to be 4 9s for 36 hours.
And your contract's 5 years?
Yes, sir.
Okay. And you said 3 years recovery. When did your contract start?
Well, the thing is when I came to the board right after my situation, I went straight to rehab on March 14th of 2021. And I guess my recovery, when I signed it, it was when I got out of rehab, which would have been June, I think it was June 7th, 2021. If it was around there is when I signed my contract with the board.
Okay.
And then, I was already in the recovery program because, but I think that's when my contract started.
So almost 3 years ago, exactly. So.
Yes, sir.
Okay. Thank you. Yeah. Any other questions or would anyone like to make a motion regarding this request?
Make a motion that we allow her to be picked.
Okay. So we have a motion, second by Dr. Krause. All those in favor?
Aye.
Any opposed? Motion passes.
Thank you.
Thank
Thanks,
you.
Leanne.
Appreciate it.
I think we've got Brent with a request to increase hours.
Yes, hey, thank you, Dr. Kirtley. Yes, I'm currently at 32 hours.
looking to be increased to full-time status by the board. Just a little bit of history of my recovery. My recovery date or my sobriety date is August 3rd of 2022. And on October 10th, after I got out of rehab, October 10th of 2022, after I got out of rehab is when I signed my first contract. And then October 10th of 2023 is when I sat in front of y'all the first time to go back to work at 20 hours a week. I got approved the last meeting to go to 32 and now requesting to be.
He's fully compliant with his contract, no problems with staff or anything else. He's got advocacy from the support group to move up hours.
Is it Dr. Roberts? I'm trying to see the
Yes.
right name. Okay.
Yes,
Grant
sir.
Roberts.
Okay. Any questions for Dr. Roberts?
No, and I'll make a motion
Okay, go ahead, please.
that we allow him to extend his work hours.
Okay, thank you. Do we have a second?
I'll second.
Thank you, Dr. Newsom. All those in favor?
Aye.
Any opposed? Motion passes.
Jake, you're up, bud.
Thank you.
Thanks, Brant.
Thank you.
There you go.
All right, so currently I'm serving a lifetime contract. I've got advocacy and permission from you guys to work 20 hours a week. I've been working 17 hours every week. Every other Saturday, I work 3 hours at the drug room in Pine Bluff with Mr. David Stover. Thoroughly enjoying my work there. Maintaining a good balance with my recovery program and work. Just going to recommended number of meetings weekly, speaking with my sponsor regularly. Let's see, I signed my ARPSG contract July 27th of 2023. And then I think we met February 6th. And I signed the contract with you guys for the lifetime. I thoroughly enjoy my job. It's a good family environment. Mr. Stover goes to my church. I don't think I could have asked for anything better by getting that job there. Everything's just going really well. I wanted to mention, so the way our workflow is, there's always going to be another pharmacist there with me. So that really helps with like stress levels and getting back into the swing of things. And it's been going really well. And I'm requesting 32 hours today.
No problems with staff. He's fully compliant, has advocacy from the group. I'll point out, and I know Jake is saying it really helps from a stress perspective, but when you move from the 20 to 32 hours, he would have the ability to work alone. So if there was a break or something, then you don't have to go, oh my gosh, I can't do this for them. So it will help give some flexibility to both you and to the store. Now, how much water did you have to mop up last week?
What do you mean?
Didn't they have, isn't that where?
Man. Yeah. It was kind of hairy on my way home at about 5:30.
No, at the store, didn't they have a ceiling issue?
Not that I'm aware of.
Okay, I thought that was a store. I had a store last week that sounds like a flat roof had water back up and all of a sudden it just down in the store. So I thought it was there, maybe in somewhere else.
Well, it's great to hear that things are going well.
Yes, sir.
Any questions for Jake? Would anyone like to make a motion?
I'll make a motion. Yeah, go ahead. Go ahead.
I'd like to make a motion that we'll approve him extending his hours.
Do you have the second, Dr. Kraus? Okay. All those in favor?
Aye.
Any opposed? Motion passes.
Thank you.
All right. And Howard, I'm not trying to cut you off if you had anything to add to any of this.
Not at all. I'm his monitor and he's been doing great. We've
Good.
Developing a good recovery friendship.
Good.
Really great to see.
All right. So did you have anything on Brian for us to kick off? I didn't know if you did or not.
Sure, I do. Now, Dr. John Barham is Brian's monitor within the group. And this is from an email that he sent me to kind of give an overview. It's 91 days at Palmetto. Brian, correct me if there's anything incorrect on this. Is discharged December 15th of 23. He's completed 112 meetings in AA, or it is AA, right? Or, okay.
Yeah.
In 112 days. And that's above the requirement of 90 and 90. He is local. He has a local home group there in Gurdon. There's actually apparently 2 AA meetings there a week. John does absolutely vouch for him. He participates in a Palmetto aftercare once weekly on Thursdays. He volunteers to chair meetings at Harbor House Rehab in Hot Springs with his sponsor. And his sponsor is here, Terry. He came up to give support and assist with cooking and preparing food for the local AA banquet recently. And he stays for setup and cleanup during events. Currently attends 4 AA meetings a week. Has not missed a check-in. So that is from Dr. Barham. And know that he's had no issues with the group. So,
Okay.
Thank you.
So Brian, the fun part for you is now it's generally the board wants to hear how do we get here? What's going on? Kind of your story.
I got you. Yeah. So I'm Brian McGalliard, an addict, sobriety date, September 17th, 2023. And just a little bit about me. Childhood, family life growing up, neither parent did drugs, no alcohol use, very limited alcohol use. Through high school, I drank a little bit, absolutely no drug use. Went to college, same thing, social drinker, no drug use. Pharmacy school, same thing. Fast forward to when I get out of pharmacy school, I become the pick. I don't remember how long it was before I became the pick, but it wasn't long after I took my first job. And there was a lot of pressure with that job, just on the job training and stuff. But I learned a lot. But my first issue with any kind of drugs was like in 2009. I went to pick my daughter up and immediately fell. Something with my back. I fell with my daughter in my arms. My wife had Darvocet. Obviously, it's off the market now from some kind of previous surgery. She gave those to me. I took them. I don't know why, but I did. I was trying to, I guess, medicate myself, obviously. And that helped with the back pain. But it also helped with some of the stress that I was dealing with at the time, or I thought it was helping with the stress. That went on for a few weeks, and then it turned into hydrocodone. I did that for about a year. And my wife actually found pills, found the hydrocodone, and the only people that ever knew about it was my wife and my dad. She told my dad about it. I promised him I would stop. I did. Stopped for like 11 years. Fast forward to 2020. Had a lot of stuff going on in 2020. My dad died in July. Pharmacy I'd worked at for like 17 years. Just all of a sudden closed after I was told it wouldn't close. My mom was diagnosed with cancer at that time. Just had a lot going on. And when the store I was working at, when I was closing out the inventory, I was struggling as far as just being able to, keep my thoughts straight, just anxiety level. And when I was closing the inventory out, I took hydrocodone again. I didn't know at the time that I was gonna have another job opportunity. But I did. But at that point where I'd stopped some 10 or 11 years earlier, it wasn't long and I was right back at that same point. I had no idea it worked like that. I know in AA, I've learned that it says in the big book that, where you leave off is where you're going to pick right back up. And it's the truth, or it was for me. So, I worked as the pick for the new pharmacy for 3 years, taking hydrocodone. I think it was September 14th, my boss, one of my bosses called me and asked me about some prescriptions. Because what I was doing was filling fake prescriptions and then selling them to myself. He asked me about these certain prescriptions. It didn't take long, and I admitted it. Admitted I had a problem. The next day, on Friday the 15th, I called Dr. Kirtley, surrendered my license, called Turner James, who was over the sport group at the time, spoke with him. And then I got on the phone and called Palmetto Rehab in Rayville, Louisiana. That the next day on Saturday, I checked myself into rehab. Spent 91 days there. At the time, I thought it was the end of my life, but now I see it was a new life for me. It literally saved my life. I've said several times while I was in AA or while I was in rehab that I had 3 options. It was either rehab, jail, or death. And I thank God that rehab was my out. So yeah, I spent 91 days in rehab. I got out December 15th. And I know you guys were asking when when people sign their contract. I think it was the following Monday. So like the 17th or 18th, I'd have to look to be certain. I have my contract, but I don't remember the exact date. I attend the monthly support group meetings. Like Howard said, you're required to do 90 meetings in 90 days when you discharge. I did like 112. So I'm actively involved in AA. And, one of the biggest things that I've learned as far as about myself is I don't have all the answers. I always felt like if I didn't have the answers, I should have the answers to everything. And I've realized that that's impossible. And on that same note, also just letting go of that pride and being able to ask for help when you need it. I was the one who always tried to solve problems on my own, and this problem I couldn't solve on my own. So whether it be asking for help for my AA group, for my sponsor Terry, and probably most importantly, just reach. I've always had a relationship with God, but it seems like it was more of a one-sided relationship. This has taught me to make a commitment, daily to seek Him. So seek, what His will would be for me. So, so I discharged December 15th. I started, as far as work goes, obviously no pharmacy. I did apply for a job like in a lab. I didn't get that job at a factory. So I've been actually driving a skidder for a logging company since the 1st of February, end of January, 1st of February. I've been doing that pretty much full time. Obviously when it rains, it's kind of difficult to log, but so this week's been tough, but I've been doing that since the end of January. And I don't know if I'm leaving anything out, but yeah, I'm here today just trying to get back to doing the thing that I'm trained for, that I love to do, and that's taking care of people. So I'm asking for 20 hours.
Thanks for sharing that.
You bet.
With us. Where do you live at?
I live in Garden.
Okay, I figured you said logging. I figured you were
South.
maybe
Yeah.
down that way.
Yeah. Mm-hmm.
Any questions
Yes, I have one.
Okay.
Okay, what do you do as your stress buster? I
As-
know being out in the woods logging, that's a big stress buster, but are you doing anything else personally?
Actually, in the woods logging, it helps with the stress for
Oh, yeah.
sure. Yeah. I mean, one thing I've always enjoyed is just sports in general. I mean, whether it's just watching sports, I love the Razorbacks. Obviously, I've been disappointed in them lately, but that's one big thing. That was on the record. Yeah, that's okay. It's fun. And then my daughter is a big softball player. So,
Okay.
spending time, she is injured right now. So that's been difficult, but that's all something I always look forward to, spending time, practicing with her. So,
Okay.
Yeah.
Good.
Mhm.
Thank you.
Yep.
And so you're doing, not just support group meetings, but you're doing AA meetings as well?
Yes.
Okay.
Yes. I do four a week
Yeah.
currently. Mhm.
Any other
That's
questions?
4 copies of that.
Do you
Gonna
know
pass them
where
down.
you're
Okay,
gonna
okay,
get to
thank
work
you.
for 20 hours or you're just starting to look?
I don't know anything definite right now. No.
So in Dr. McGalliard's case, I'm actually passing down the 106 report. Dr. Boone had told me earlier he intended to recuse on this discussion since he was the employer who had to file this. On your diversion, it was a little bit different because it was fictitious prescriptions. So for a store, all the counts were always absolutely exact down to the pill. He was very, scientific pharmacist driven in that he had, fake patients that would have it as being dispensed to them under prescriptions that weren't really prescriptions. Dave, you can pass them down. I only had 4 of them.
Oh, these are supposed to be passed?
Yeah.
Oh, I thought they were copies of.
You
the
can look
same
and
thing.
pass.
You wanna look at this one?
Yeah.
Okay.
I think that like it was a prescriber that was no longer in the area or something along those lines.
Exactly. He started in the area and then moved.
Yeah, it
So,
moved away. It was no longer there.
Yeah.
So you've had no missed, random screens or anything along those lines?
No, sir.
Is there any typical thing of how soon they go back to work? Is it just different for everybody?
Well, it is different for everybody. What we're generally looking for is advocacy from the support group, and he has full advocacy from the support group. So the board always has kind of 2 questions. One is, is the board willing to let this person re-enter the practice of pharmacy, which is a yes or no question. And then if it's a no, is there a plan to come back at a future date? And the board has had people before they've said, we would see you again in 6 months or a year. If it's a no, if it's a yes, then it's under what type of contract? And we've had different types of contracts over the years. It has appeared more recently, at least, that the board starts with a discussion of a lifetime contract and then would have to make a differing decision to do anything less than that. Those contracts usually would include, no matter the contract, 5 years of probation as a status, which includes 5 years of community service where there's at least 20 hours a year of community service. Am I missing anything on that? I don't think so. Those are the kind of general parameters.
You said it would be a lifetime contract, not a 5-year?
After the last couple of discussions that the board has had, I think that the board has looked at, well, it's a lifetime unless the board makes a differing decision. I know like Mr. Cash got the last one, which was lifetime. But that's up to you guys. And it's while practicing.
The most important thing to us is the full advocacy from
Yeah. Yeah, which he has.
Any discussion? Any questions? Okay. You want to make a motion?
I think, did we work together when you were training at Heartland?
Mhm.
Okay, that's hi. I don't know. Does that matter? Am I good?
Yeah.
Okay.
The first question is if the board is willing to let him go back to practice. And if that's a yes, then you have your other discussion.
Okay, so do we have a motion on?
I'll make a motion that we allow him to go back to practice.
Okay, so we have a motion,
I'll second.
have a second, all those in favor?
Aye.
All right.
And I guess the second part is the stipulations.
Yep.
So you said lifetime, well, that's what we did last
That's
time.
up to you guys. I mean, it's.
Lifetime, 5 years probation, 20 hours of community service per year.
Unless the board wants to do something different. I mean, there was a time when everybody would generally start with 5 year. We had a couple of weird ones over the years that were 7 years, and then we've had some 10s and lifetimes. I know, I think Mr. Simpson had felt pretty strongly about it, and we'd had a couple of discussions at both informals and at formal meetings that in some ways, some of the, not that we see a tremendous number of relapses, but we do see some, that it's, well, possibly the best insurance is if you've got a pharmacist license that you are monitored. It has been fascinating. I know Howard's seen this. Howard, how long you been on contract now? Since 1998
A long time.
or something?
Decades.
Yeah. I mean, he was on contract far before he even got the opportunity to practice again. Where it gets fascinating is, if someone tells me, oh, Howard's doing such and such, goofing up, he's relapsed, I'd be like, well, actually, I can look in the system and tell you that last week he was sober and 4 weeks ago he was sober. And that another thing that we had discussed, I think the support group and Howard know this better than me, was discussing, relaxing of some of the terms so that people could take trips and vacations and trying to be more open-minded about that. Because for a long time, it was very, very difficult to get any time at all. But I think through some great conversations with our leaders at the support group that there's more thought and discussion about that. You could speak to that better than I can.
Well, and Howard, before you, I haven't met you.
I haven't.
Sorry, I don't think any of us know you.
Yeah.
So it's good to have you here, but I was afraid I missed something in the February meeting or something like that.
Howard, there's a board that doesn't even know you now. Except for me and Lenore.
Yeah.
The only thing I know
That's nice. I recognize Lenore right off the bat.
The only thing it looks to me like is you're a Rolling Stones fan based on your socks.
Yep.
Absolutely.
Okay.
My wife gave me permission to go to the concert in Branson, and I'm taking my 19-year-old
There you go.
in the pit.
Yeah. I had a chance to see him at War Memorial back in the 90s, so yeah, I'm a
Wow.
big fan too.
It's I love to see people in their 80s just it's inspiring at age 63 to see that.
Yeah.
But yes, I know to go to the question that there have been some relaxations of, I'm not sure exactly what all of it is. I think there's 27 vacation days we can
Something
request now after 10 years, but it has to do with 10 years of monitoring and pretty much very little issues, if any, definitely no relapses because, that would start a clock over. Just because as we've gotten older and some people have been with the same company for a while, they have more vacation and they want to just, if they want to go somewhere for a while, go to, spend a couple of weeks in Europe, go spend a couple of weeks in Europe. When I was on committee, I actually voted for somebody who had a health issue that was less than 5 years, but it was a honeymoon. They were going to Greece and there was some opposition. And I was very adamant that I'm not going to be cruel and be on this committee.
Yeah.
And he was able to have his honeymoon, go to Greece, no problems. I think it's been 10 days or something, but.
And we've discussed if there's truly concern, there are other, not just urine, but other testing that we could do that the support group could ask for. But I'm hopeful that the message from the board was the board's intent wasn't to micromanage, you only have to do this and that, but there was a level of trust with the executive committee at the support group of, if it makes sense, then do it. But don't think that it's the Board of Pharmacy saying people can't take a vacation or can't get a timeout. And we've had it we've seen it for years where people have, medical conditions. If you have a heart attack and have to have bypass surgery, like no one predicted that day. And yeah, you're not in trouble because you had a medical procedure or you have a car wreck, or you have a,
Sure.
a hip replacement or something like that.
Snow days are
Yeah.
notorious. I'm probably the only person that ever called in to check to see if I was drug screened outside the country.
Yeah.
Because I got stuck in Guatemala because of I was on a medical mission and there was a volcanic eruption, all flights delayed for the next day.
Yeah.
So, but I checked in anyway, just,
Yeah.
there's nothing else to be on the record for it.
Yeah.
So Howard, are you the executive director for the support?
No, he's
group?
one of
So
the-
you-
he's one of those-
No, I just.
Okay.
He's just here for support.
Okay, gotcha.
So Turner's not there anymore, or, okay. I didn't know that.
All right, so well, I guess the follow-up to the previous motion was what stipulations we want to put on this from a contract standpoint. And then I think the other part to it is he's asking for 20 hour to go back to work 20 hours a week.
Yeah, that would be generally automatic with the contract.
So any further discussion or questions? Would anyone like to make a motion?
What do y'all think about the contract limits? That's the big question right now.
I was thinking lifetime might be good simply because he did do wonderful for 11 years and then had a opportunity. So if I think we'd be helping you by staying on there. I hate to make it lifetime, but that's kind of what I was
Mhm.
thinking.
Yeah.
Oh, I don't really have a.
I agree. Especially because it seems to be related to stressful events, which are unpredictable, so.
And then are you guys thinking 5 years probation and the 20 hours a year of community service?
Yeah, we would not want more than that. I mean, and the probation is generally just a status issue. It doesn't limit him. He's on notice, basically.
Okay. Is there anything we're leaving out that we need to decide? And you said that motion would automatically allow him to go back to.
It would approve him. I know Ms. Bales, I don't know if she's got it yet, but I think we've just got a little bit of paperwork to do to put those details in a probationary consent order, and we would have it to him probably by the end of the week and returned so that he could seek employment. There are things that, for people in the support group, we generally suggest, like, before you start talking to somebody about a job, I would highly suggest you call the office and talk to either myself or Dr. McCready to say, like, hey, we've had people before that got down a road interviewing for a job and went, I won't approve you to work there. Like, what you don't realize is there's stuff going on I can't tell you about. I mean, we've had places where, like, you don't realize this, but the DEA is going in there in about 4 days, and I can't tell you why, but I'm not going to approve you to work there. And people are like, oh, this is a great opportunity. I'm like, you don't want to be there. Or if we know that there's some other problem. And in reality, there's probably 5 or 6 stores in the state. Like, if we've got a store that isn't in Class A status because of issues on inspection, I generally wouldn't send someone fresh from the support group into that because the store's in trouble. And
So will you approve, like when he does find employment, will you guys be the ones that?
Generally, they will
Vet-
reach out to us and
vet
say,
that
hey,
location.
I'm looking for this person. The support group will actually line up that he has like a workplace monitor in that location as well of someone who's reporting on how they are doing, quarterly, for working it quarterly, I think. Yeah, quarterly with their work and everything else.
Okay. So tentatively, it sounds like we may have some consensus around lifetime, 5 years probation, 20 hours community service per
Right.
week.
I like a motion to
Okay.
that effect,
Okay.
that we set up a contract with those stipulations.
Okay, thank you.
Second.
Second from Dr. Kraus. All those in favor?
Aye.
Any opposed? Motion passes.
Brian, we will get this put in writing. If, before you leave, let's make sure that we've got like the best email address and everything for you. Ms. Bales will get that. And we should have it to you to look at. If you've got any questions on it, we'll go over each part of it with you to make sure if there are any questions.
All right. Thank you, guys.
Thank you, ma'am.
Good luck.
Good to see you again.
Yeah. Well, Lena will. So I can put that there. Say Boone, lots of opinions.
Yeah, we'll break for.
Yep. 5-minute break.
Yeah.
Okay.
Go.
You guys ready to start back?
Yes, sir.
All right, for our 9:45, we've got Heartland up for remote order entry, and we have under tab number 2. This is a, fairly standard for different community retail stores to be able to order entry for each other. You want to introduce yourself and tell us who you're with? We'll kick off. Yeah, hit push and they'll turn green, which means go. There you go.
Yeah, good morning. My name's Chris Cooper. I'm the Director of Operations for Heartland Pharmacy.
So what do you want to do, Chris?
So today, I wanted to propose off-site data entry for Heartland Pharmacy. This is for our 11 locations throughout the state to allow for data entry to another Heartland Pharmacy location. Using our system, we have real-time data. So that would allow any of our pharmacies to input a prescription, send it to a queue at that prescription to then be dispensed and filled.
Y'all already got that? Okay, and you've already got like a strip packing machine at one facility. I think you guys did you already get approval to do that for another store?
We have the strip packing at our Bentonville location and it is a central fill. Yes.
Okay. So they've already got kind of the central fill. This is just another branch off of it that would allow them to do kind of workload sharing or balancing across all their stores. It's fairly simple request that we've seen many times in front of the board. And since it's where it gets more difficult for us is if they were trying to contract with like a different group of pharmacies or something else, that gets a little bit more hairy. But since it's within the same corporation, it's pretty easy.
I think
Do you guys have a shared database or is it you log specifically into a store?
It's real-time database between each store, but in this case, they would be logging in remotely into that store's server, processing that prescription. It would then send it to the queue at that store to be dispensed. So they would just be doing the data entry and the adjudication of the claim.
Then does your record reflect who did every piece
Yes,
of
you can log
everything,
in and see.
regardless of what store they were at?
That's correct. You can see which user was inputting, which user did the adjudication. And then at that point, it goes to the pharmacy for dispensing at that location. Yes, we already do. No, this is all done. So in the SOP that I submitted, it was only from a licensed pharmacy to another licensed pharmacy.
Yeah, which is the only way our retail rule works.
Yep.
Does the patient data reside at multiple sites?
So the actual physical prescription will be held at the site for dispensing. So the site that dispenses will keep the prescription record. But any pharmacy, any of our location can access that prescription at any time.
Yeah, but the computer data.
Is it cloud-based or if I'm entering for your store, do I enter to your computer at your store or is it all centralized?
It's centralized. Yeah, it's not actually using it's not actually using a physical computer at that location. It's going to a real-time data server that communicates.
So is the data also stored at the local stores on the local store server?
Yes, it's stored at 2 different servers. It's stored at the local store server, and then it's also stored in a central server that houses all of our data for all of our locations.
And who provides the encryption?
It's through Pioneer RX. They do all the data encryption and security for it.
And I take it it's backed up to the cloud?
It's backed up to multiple servers, yes.
Okay. Thank you.
Okay, sounds like everything's in order.
We're good.
I'd like to go ahead and make a motion that we approve remote order entry for Heartland Pharmacies.
I'll second.
We have a motion and a second. All those in, sorry. Yeah, I'll make note that
Dr. Boone is
Dr. Boone is
recusing.
recusing from the vote. All those in favor, please signify by saying aye.
Aye.
Any opposed? Motion passes.
All right. Thanks, Chris. So our next thing on the agenda is 10:15, but I believe our 11 may be here. Is that okay, Counselor? You guys with East Arkansas? You want to get done early? Come on up.
John,
That's all right.
that one on the end, will that one work?
I'll switch it real quick.
Is this on that right?
I know what it is.
Good morning.
I'm doing well. How are y'all doing? Good. Yes, yes, we're doing well. Thank you.
Thanks for the time.
Yeah, looking out for you. I can get back to my documents here. Good. All right, you guys should have under tab number 5 for East Arkansas Family Health Center Pharmacy, and it is a very similar request. If you guys want to tell us who all we're talking to this morning.
So I'm Judy Ali, pharmacist, Chief Pharmacy Officer for East Arkansas Family Health Center.
I'm Dr. Susan Ward Jones, the CEO of the organization.
My name is Dr. DeWitt Hill. I am the pharmacy supervisor of operations.
Okay. And if you can tell us real quick how many locations you have and where they are, I think that'll help the board understand kind of what we're talking about.
So we have 3 pharmacies. Those pharmacies are in Lepanto, West Memphis, and Marvel, Arkansas. And we are an organization which is an FQHC. And how many locations?
Actually, we have 12 locations dispersed among 5 counties, and a mobile van, and we just provide primary care for citizens of those counties.
And I found it is in the application appendix A, page 3 of the handout. That'll show you kind of where the locations are. But as I read this and look at it, it's basically you want to be able to do some workload balancing between your 3 locations. We had some of this in the background on the last one. I know one of them is much busier than the others. And my understanding is the one that is not as busy, is it Marvell or is it the other one?
Marvel and Lepanto.
Okay, would be able to help do some order entry for the West Memphis location to help back up staff there.
That's absolutely right.
And for your system, I know they were using Pioneer. What system do you use?
We also use Pioneer RX.
So, okay.
And if I can use what he said, we basically are doing the same thing.
Yeah.
The software has the same capacity to do the same thing.
Yeah. So for Mr. Simpson, they use the exact same system. We've got a lot of pharmacies in Arkansas that use Pioneer, and they have really good functionality for this type of approach. No problems with staff. It's a standard for us.
Again, it would be from a pharmacy to a pharmacy, not at home or.
Absolutely.
Yeah.
Yes. We like our home time.
They do.
If there's no questions or additional discussion, do we have a motion?
Yes.
Second.
Okay, I'd like to make a motion that we approve East Arkansas Family Health for remote order entry.
Okay, so we have a motion from Dr. Newsom. We have a second from Dr. Kraus. All those in favor?
Aye.
Any opposed? Motion passes.
Thank you. And I did send in the request and the policy for Central Field as well.
Did I miss that?
Oh, no.
Oh, it's with it.
Yeah.
So tell us what you want to do with Central Field.
So that is a matter of truly what's going on with the drug shortages. And it's as simple as that. Now, we do have 2, what they call closed door pharmacies. They are 340B. And then we have Marvel, which is open to the public. We understand that and there are rules that we have for who's considered a 340B patient that will always apply. We do have drugs that we acquire with different contract prices. So the rules that we already apply for all of our pharmacies will stay the same if we need to do that. So if we are able to get some medication that the Marvel pharmacy is not able to get and is not a 340B patient, we know that we can only dispense on using that WAC account. So we already have all those things in place.
So it sounds like, and I throw out drug names that are just common, not because I'm picking on them, but if you can't get Embrel at Marvel, but you can get it at West Memphis, then what you want to be able to do is have West Memphis Central fill it and then send it to Marvel for the patient to pick up.
That's exactly right.
And the only kind of different thing with that is, you know, you have to have a sign up at the stores that their prescription may be, you know, for offset order entry may be processed, but also when you have central fill may also be filled at another location. And then that end prescription, if it's fulfilled at West Memphis and delivered to Marvel, then it has to have designation on the label, which Pioneer can do that for you too, where it's, you know, filled at West Memphis location, but dispensed at Marvel so the patient can kind of tell, and then the paperwork. That's another standard request for us.
Do you have a third-party administrator that qualifies your claims?
Yes, for the Marvel pharmacy, at our in-house pharmacies, they're all 340B claims. So we only do patients of our organizations.
And I can help clarify. When she's saying closed door, she doesn't mean closed door like we think of a long-term care pharmacy. She's meaning that they will only serve prescriptions from their prescribers. They don't take external prescriptions because then they can't qualify whether or not they would apply to 340B. So it's not that it's closed to the public. It's just not a pharmacy for whomever to walk up and use. That makes sense.
They have to have been a patient of ours within the last 2 years, within 2 years. And now with outside prescription, we can take if they have a referral that's the only exception.
So your closed doors are all patients of your, I want to make sure.
Yeah.
The closed door is like, if it's not a patient of your FQHC, you don't fill prescriptions out of your closed door. But your 3 locations that are open door, do you take
yeah, Marvel's open to whomever.
And that's where I was going with that is like, if you're going to do central fill, are you only going to do it for FQHC, your own patients? Or is it going to be for potentially non-FQHC patients as well?
We haven't decided that all the way through operation, but for me, I don't want to muddle the water.
Yeah.
So unless it's an issue, we don't want to muddle the water. So we rather just keep it clean.
Mm-hmm.
Yeah. Okay.
John, now, does the patient have to pick it up in Marvel, or can Marvel deliver it to West Memphis for the patient to pick up?
Under our central fill arrangement, if West Memphis was to fill it for a patient in Marvel, they could either send it to Marvel and let the patient pick it up, or they could deliver it straight to the patient. We have flexibility in that.
Just want to make sure.
Yeah.
And we do understand that, you know, we do have 12 locations, which are clinics. We understand the pickup station does not apply to this.
Yeah,
So,
it's only between the 3 actual stores.
Right.
And so under this model, each store would be a central fill pharmacy theoretically.
Potentially.
Yeah, okay.
I mean, we have taken a fairly agnostic approach to, if you have it at one location and another one needs it, you either say, well, we're going to loan it to them and someone's got to shuttle it from A to B and they have to process it. Or you can just, especially with Pioneer, you can pick it up in the system, print the label here, and I can send it to the other location prepared instead of doing double work. No issues from staff on this either.
Yeah, I'd make a motion that we allow them to have the central fill.
I'll second. Rodney can.
Go ahead. Okay, so we have a motion from Dr. Kraus, second from Dr. Mack. All those in favor? Any opposed? Motion passes.
thank you.
Thank you, guys.
Yeah, thank you.
Now, all your people saw you got done early, so they're waiting on you to get back early too.
Or you could go shopping. That's your option. Yeah.
Traffic out of here could be terrible sometimes.
All right. So I did pass out to everybody. We've got time for just a couple of possible discussion points. First off, the discussion that we had yesterday about emergency kits. If this has highlights for everything that I had that the board indicated to do yesterday. If you look at it, it's cephalexin 250 and or 500 milligram. It does have a maximum quantity of 6 above that. The next one, Augmentin 500, 125 and or 800, 125 limitation. since clindamycin is a unique drug class, instead of adding a whole nother classification, I put it under miscellaneous, clindamycin 150 or 300 milligram, max of 6 doses total on that, instead of adding like lincomycins or what, however you say that. Eliquis 2.5 and or 5, so they could choose how they want to split that up. Insulin, and then in the parenthetical, I put regular, Lispro, Glargine, ... I mean, it's whichever insulin they choose that they think they need for that facility, max of 2. So if they're doing either vials or pens, they could choose whatever they want to have an assortment and have 2 of them. And then metoprolol, 25 milligrams. So it already had tartrate or succinate, and I put succinate ER so that if anyone's confused what the intent of that is. On the backside, under respiratory medications, added albuterol HFA inhaler with a max of 2. And then under the anti-hyperlipidemics, I just added on the atorvastatin, comma 20 and or 40.
On the augmentin, is that supposed to be 875?
Yes.
So it looks like the only unique, like new molecular entity that was added, if you will, is really the Clinda. Everything else was kind of different strengths or dosage forms.
Yeah, pigeonholed in there.
Question is, Novolog and Humalog, are they biosimilar?
They should be, but I don't think that they're biosimilar. I don't believe they are interchangeable in the purple book.
Well, the reason I ask is because, I mean, they're generally considered
equivalent,
but you've only got one listed. So it's kind of like we've selected Lispro and left out the aspart.
He's got the ...
I think I got ...
Yeah.
because those are the specific ones that were specifically requested.
That's what ...
Mhm.
Yeah.
You can do it, et cetera.
What's that?
Et cetera.
And so forth.
Yeah.
Thanks, Dr. Curtley.
Yes.
We had a long conversation yesterday and you go in and you just simply put it in and fit it in. So thank you very
Right.
much.
I'll fix the 875. I just typed
I
that.
think it's good. I think it's good that we still cap the doses, just.
Yeah. And the other
Cap
thing
the
is,
number of pills or number of units that could be stocked.
Do we need a motion or anything to approve the updated list?
you already motioned yesterday. I'm just trying to be sure that you guys have seen what I have. Because this is what we will, as staff, I'll remove the highlights from it and publish. And we'll see if we get a whole slew of people that decide that they all want to do their own little tweaks to it. My suggestion, once again, is let's just reform a committee and get a report from the committee rather than micromanaging this and spending 30 minutes of a board meeting on it.
It should help anybody that's already out there.
Yeah.
Being it so limited is just for like logistics, mainly, right?
It's emergency. I mean, there are, I have heard legend of states, and I have not observed this myself, that if you don't have a list or a limitation, pretty soon, everybody wants one more thing. It's how much stuff can I cram in my car? And the next thing you know, you have pharmacies. I mean, we've had pharmacies in the state that would say, leave the list alone, because every time someone thinks they can have something, they think that they've got to have it. And it's the pharmacy's money and the pharmacy's liability of trying to get paid.
That's why I was
That's sitting
confused
there.
yesterday, because it was pharmacists yesterday that were
It
here, right?
really was. Yeah.
I think they were I think their theory was utilizing it wrong. When we
Totally.
kind of explained it to them, then they got it, I think.
I still don't think they're getting medicine to people in 2 hours.
Well, I don't think they care about the same things that,
I think there was Omnicell was what was on there. I don't know. That's not the same company.
Omnicare.
Well, it said Omnicare, Omnicell / on the
Oh,
agenda yesterday.
I think that the Omnicell was that was the machine request. It was just on the agenda. Odd.
They asked for a machine yesterday too? Okay.
They'd already been approved for it. They're using this emergency kit in an Omnicell. in some instances, as I recall. Next thing I passed out, this is a list of all of the types of either disciplinary or non-disciplinary orders that we have had last few months. Generally, Dr. McCready goes over these. We discussed this morning. Here is the list. If you have any questions about the list, then we can help answer them. Otherwise, we could just have a motion to adopt the entire list of orders for consideration.
Why don't we do that, John?
Well, you could either take them one at a
I
time.
thought we have, or never mind.
Yeah, or you can take them as a group.
Gotcha.
For one thing, we quit doing them one at a time because if we misstate anything on the verbal record, like if you say, hey, I want to accept all these disciplinary fines, well, a lot of them aren't disciplinary. So by having them in a spreadsheet, it helps to designate that this is what it is, just a link to the document rather than having confusion when other people go, why isn't this in the national database? Well, it wasn't disciplinary. Well, it said that on the board minutes, on the recording. We're like, well, it was misstated.
Yeah.
If you read the document itself, it wasn't. Well, so this helps us with arguments more than anything.
Right.
This does
Make a
not.
motion that we accept this.
Yeah, and we've got things like PIC, which is a fairly standard thing. Challenge change of ownership notification wasn't done in a timely manner. We did kind of an audit process of reverse distributors and found several that did not have permits, but they then got legal with us and got permits. So that is what that reflects. A couple of standard med error approaches the board had approved us to do. And we have a couple of CE violations that were early adopters that we had. And then there's a couple, the very last couple were actually from informal conferences. So they've technically already been sent by the board, but this is a presentation of what we have. We have many more CE orders that will go out. We have a couple of people that think they want to come and have a hearing before the board. We have explained multiple times from staff. I have, Dr. McCready has, Ms. Bales has. I think that people are venue shopping with us. And what we tell them is, we don't have room to make a decision as staff different from what the board has said. If I'm licensed this biennium, the requirement is that I get my CE this biennium, not in order to renew. Now, we don't check it unless you renew, but I'm required to get that CE as part of my ongoing training while I am licensed. And we have people that say, well, I called up there and someone told me I could reactivate my license. Yes, you can reactivate your license, but you didn't get your CE while it was actually required. It's not required January 1 of this year because you renewed last year. It's required during the licensure biennium. We have some people that we think may basically just say, no, I want a full hearing before the board because I don't think I should have had to get my CE because of whatever reasons. What we offer them is, for every hour that you are short, it's a $100 fee, and we call it a paperwork fee. It's non-disciplinary, and you have to make up double what you missed. But if we have someone that has 0 live CE, we apparently still have some people that think they didn't have to get live CE because COVID happened in the past. And it's $1,200 and you got to make up 24 hours of live CE. I mean, we have had more live CE available via more venues and computers and cell phone and everything else than ever before in our careers as pharmacists. But we have some people that have none at all, or that are just being unresponsive to our request for the audit. And we're able to look at the national system, the data bank that has all of the nationally accredited CE in it. So if you've got 20 hours in there and you don't even send us anything, Dr. McCready will do an order that reflects that we know you had 20 hours. Like, we're giving you every benefit of the doubt that we absolutely know you have this. We've had people that we have some CE providers that just don't get it loaded into the system. And so we've gotten letters from them of, we don't know why this is in the system, but yes, this person was an attendee and did get credit for this CE. We get a lot of stuff that it's people that have on-the-job training, like they do a HIPAA module at work. or they do some training on the software system or the hardware system. You know, I did Epic training at UAMS and they'll go, oh, here's my CE. That's not CE. It's on the job training.
So why can't somebody attend board meetings anymore or CC?
With the proliferation of CE, the board just kind of stopped doing that years ago. Most of the people that are attending the board meeting, I mean, how many people are here that are pharmacists? Are you guys licensed pharmacists yet? So people watch it online and it got to be, well, I want CE credit because I watched an hour online.
But we say you gotta be in person to get live CE.
Yeah, but no one's applied for it in years either. You always had more CE than you needed for that.
Breaking by these days.
And the other thing is, I think we had some board members that would have basically said, it's fairly self-serving if I try to claim CE credit for attending a board meeting that I'm at. Yeah, well, I mean, you learn a lot, but I'm saying, like, I don't get CE credit for being here. I've had people get mad at me. Someone was upset at one point because I got CE credit for a CE that I taught. And they're like, well, do you claim credit when you teach a CE? And I'm like, well, yeah, I attended it. I also give myself negative feedback if I did bad. And they said, well, that ought to be unethical. And I'm like, what? I said, well, some professions, if you teach a CE, you get double or triple credit what you actually taught. I think law's that way. Yeah, because you had to learn it and be the expert to teach it. I was like, well, I mean, if you're really that mad about it, I think I had 99 point something hours last biennium. I don't think that made the difference for me.
Hey, John, on the reverse distributors, quick question. Did we have any did everybody that we needed to track down get right, or did we have some that didn't respond, or?
I think we did. I think everybody was responsive. I think we had a couple that I think decided they had no real business in Arkansas and just aren't going to do business in Arkansas. And we double checked even with some of them, and then the others got right with us.
We sent to the entire list of reverse distributors that we had. Some had done no business, maybe had one store they did.
Not sure if it's who we're waiting on, but there is somebody out there.
That's our sport report.
Yeah, I think I heard earlier, I heard a motion from Dr. Mack to approve.
I did.
Make sure your words are right.
Okay, so we have a motion and a second. If there's no further discussion, all those in favor?
Aye.
Aye.
Any opposed? Motion passes.
I can tell you that when I looked over Dr. McCrady's shoulder for our CE audit thus far, it looks like it's going to be about $70,000. So it's, or no, isn't that right? It's hundreds of hours that people are short.
More in-state or out-of-state?
Yes, it's all over.
All across the board.
Like you could look down the list and go, why did that person not get their CE? Or why is this person not responding to us? Or
And they get mad because I explained to them what the law is and.
And it's made so much easier
just a
now.
little
Before it was a little harder. Now it's really easy.
And then they call Ashley and tell them I had my stinger out.
How much?
Brenda had her stinger out for somebody.
For pharmacists in general.
Yeah.
Because I get to do the audit.
It happens every biennium. We have people that just are absolutely incensed that it's like, how dare you not believe I had my CE? And it's like, well, you didn't. Like we didn't say you didn't have your CE. We said we can't see it on our side of this exchange. So send us your CE. Like we're just asking you. I mean, send us your CE credit. And we've had people that have tried to send us stuff from the previous biennium and from this year. And like, well, I've got it now that you've asked for it. And like, you didn't get it when you had to get it. Now you can make it up that way, but it's been a difficult conversation. And got a couple of people that they would renew inactive and then before the end of the year and got an inactive license, then before the end of the year went back in the system and like clicked the button to change to active during the renewal period. We didn't even realize that was possible. And they're like, oh, I've got an active license now. We're going, wait a minute, what? So you told us you didn't have CE, you changed your status and then tried to say, hey, I've done makeup CE, you can't do anything to me. Like, that's not how this works. Like, sorry, officer, I know I was drunk when I was driving, but if we can sit on the side of the road for 5 hours, I'll sober up and I can go on home. Like, no.
Do we have other conversation from yesterday you wanted to have or not? It's a conversation yesterday.
A discussion.
Discussion.
I've got other discussion stuff, but we've got a
Oh.
10:15 that,
Can we take a break so the court reporter
yeah,
can come?
we've got to get the court reporter set up, hearing officer, and get
How
to
long do you
hearings.
want to break to? 10:30 or do we need longer?
Oh, 10 minutes.
Yeah.
10 minutes?
Yeah.
Okay.
That's pretty close to 10:30.
Okay. So we'll be back at 10:30.
They said you had to get notified. Oh, they did, but it can't be another flat. We're back on. That's already getting out. The agenda, I couldn't get the agenda to pull up on my computer, but it will pull up on my phone. Yeah, I meant to tell John that this morning. They used to have like a 1-day registration. They put his name wrong on his committee meeting this afternoon at the Capitol too. John put Vincent. They do that to him all the time.
Morning.
I need you first. I don't need you second.
Mr. Molson, are you ready?
It doesn't
Okay.
matter.
So we're back to discuss a technician application denial, and I'll turn it over to you, Mr. Moulton.
Thank you, Mr. Chairman. Next item on the agenda is filed before the Arkansas State Board of Pharmacy in the matter of Megan Thompson applicant, case number 2024-047. For the record, my name is Charlie Moulton. I'll be acting as the hearing officer for this proceeding. I will also take judicial notice of both the statutes as well as the rules governing this proceeding, specifically Arkansas Code annotated 1792-101 at sequence 17-92-305 and 92-317, as well as the Arkansas Administrative Procedures Act. Ma'am, are you Ms. Thompson?
Yes.
Would you?
Megan Thompson.
And if you could, probably the easiest thing, see how I've got the microphone, just go ahead and pull it. It slides. Yep. Perfect. Okay. I need to ask, and Ms. Mills, would you be so kind of to identify yourself for the record, please?
Megan Thompson. Oh, sorry.
Ashley Vales, attorney for the Arkansas State Board of Pharmacy.
Thank you, ma'am. I need to take care of some housekeeping matters first and kind of explain to you how the process works as well. First thing I need to ask is, have you ever been in an administrative hearing before?
No.
So it's probably unlike anything that you've ever experienced before. As the hearing officer, I run the hearing for the benefit of the board members, but also yourself, okay? So as we go through this process, at any time you don't understand what's happening, let me know, because I want to get on the same page with you. Because one of my roles as the hearing officer is to make certain that you get your story fully told in front of this tribunal. And if you think that's not happening at any point in time, I'm not doing my job, and you need to let me know that, okay?
Okay.
You're doing a great job so far. I've got a court reporter right next to me. It's really important to give a verbal response to any question that you're asked, as opposed to a nod of the head, because she can't transcribe a nod of the head. And if that happens, I might stop the proceeding and remind you, I'm not trying to be mean. I just want to get a good record for you, okay?
Okay.
So you have received a copy of the order and notice of hearing today, correct?
Yes.
And you're representing yourself this morning, is that right?
Yes.
And you are ready to proceed, correct?
Yes.
Okay. Some other housekeeping matters, Ms. Vales, how many exhibits do we have on this one?
We have 19 exhibits that I'll move to introduce into evidence.
All right. Ms. Thompson, I need to ask you, do you have any objection to the admission of staff's exhibit 1 through 19, which is that packet that's right in front of you?
I don't believe so. No.
All right, thank you, ma'am. Without objection, exhibits 1 through 19 are admitted. Besides the documents that are in this packet, did you bring anything with you this morning that you would like the board to look at?
The only thing that I brought, I did email Ms. Vales.
I think everything is in here.
Yes.
Okay, all right.
On the tablet as well.
I did bring copies, just in case.
If it's not in there, we'll make certain that they get it. Okay. Let's just double check.
I do have one question. One of the charges, it was listed as a Schedule 4 in the original order, but it was a Schedule 6 in the sentencing order and the probation order. So it is listed as a Schedule 4 on the paperwork
Okay.
that you
Well,
have, but
You'll be able to explain that through your testimony. Anybody else that you might have brought with you this morning in terms of a witness? Just yourself? Okay. So here's what's going to happen. Ms. Vales is going to call her a witness, which I believe is going to be the director. I'm not certain because he's sitting next to her. Because you're representing yourself here this morning, you have the opportunity to ask him questions if you'd like. It'll be a little bit different because although I'm not making the decision, I'm running the hearing, the board members are, they get to ask questions as well. And typically they do. After she's done with her presentation, it'll be your turn. I'll turn it over to you. You can provide them with a statement of what transpired, what happened, and why you want a pharmacy tech license, okay? After you're done with your presentation, Ms. Vales may ask you some questions. I'm fairly confident the board will ask you some questions too. After all the evidence is in, they go off the record, they deliberate, and then they come back on the record and announce their decision with a motion and vote, okay?
Okay.
All right. Why don't we go ahead and just swear in the witnesses at this point?
Another one, McCready.
Dr. McCready's behind me. You're going to be testifying too, so you need to swear as well. Do you swear affirm the testimony you're about to give in this hearing is going to be the truth, the whole truth, and nothing but the truth?
I do.
yes, I do.
Thank you, folks. Ms. Vales, would you like to do an opening?
Just briefly, board staff reviewed Ms. Thompson's application. There was some criminal history. The one that was most concerning is a felony drug conviction, a Class D felony. I'm going to let Dr. Kirtley testify as the ramifications of that with her working in a pharmacy. She did go ahead and get that completed, the terms of probation, and get that matter sealed. But as the board is aware that the effect of sealing doesn't apply, and you can still consider that because we are a board licensing healthcare workers. So that is still subject to your review in this hearing. And there's some other misdemeanor violations as well that we'll talk about. But that is why, and just in general, why we brought Ms. Thompson in here for a hearing today.
Thank you, Ms. Vales. Ms. Thompson, typically you have an opportunity to do an opening as well, but it's been my experience that your opening is going to echo exactly what you're going to tell the board anyway. So I'm going to ask for your indulgence. I'm going to give you every opportunity to tell your side. Just waive your opening, but we'll get to your story, okay?
Yes, I agree.
Ms. Vales, go ahead and call your first witness, please.
Dr. John Kirtley. Dr. Kirtley, you're the executive director of the Arkansas State Board of Pharmacy, correct?
Yes, I am.
And did you have an opportunity to review the materials that Ms. Thompson presented with her application?
Yes, I was.
And we, as a staff, denied her application.
Yes, we did.
And can you briefly tell the board just a summary of the disqualifying criminal history that came up in the application process?
The most concerning thing that we saw was back in October of 2012. She had been arrested for delivery of and they did mark it as a control Schedule 4 substance, Class D felony. I do understand that in general, that would be classified as a Schedule 6 in the state of Arkansas, but that's the way the court documents were seen. She was sentenced to that Class D felony after entering a plea of guilty, sentenced to 5 years probation, 120 days in the Benton County Jail, payment of fines and court costs. She did have a drug court case that we understand was sealed later on, but on this one, it appeared that since she had entered in that plea of guilty originally, that it would be a disqualifying offense under federal regulation for anyone to have access to controlled substances.
And you're referring to CFR
1301.76.
And
We
tell the board
actually,
what that says.
we actually have a copy of this in other laws and rules on your tablet. 1301.76, as many of us refer to it, has specific language in it that a registrant, meaning a DEA registrant, such as a pharmacy, whether it be a community pharmacy, a hospital, a surgery center, or anything else, the registrant shall not employ as an agent or employee who has access to controlled substances any person who has been convicted of a felony offense relating to controlled substances or who at any time had an application for registration with DEA denied, had a DEA registration revoked, or has surrendered a DEA registration for cause. For purposes of this subsection, the term for cause means a surrender in lieu of or as a consequence of any federal or state administrative, civil, or criminal action resulting from an investigation of the individual's handling of controlled substances. It goes on to explain how the registrant shall notify the field division of the DEA in the area in writing of any theft or significant losses, and goes on with other language. The basis for this, having been here almost 20 years, is that our friends at DEA, our colleagues there, will tell us that if you've ever entered in that guilty plea that has been shown in court records for any drug felony, no matter what the classification is, that it is illegal for that person to have access to controlled substances in a pharmacy unless they have been granted a waiver from the DEA or if they've been directly granted a DEA registration, which is usually something that might happen with prescribers.
So is it safe to say in interpreting the statute that a DEA registrant wouldn't be necessarily allowed to hire Ms. Thompson as a pharmacy technician?
That would be true. In this instance, it is a little bit more difficult to deal with because the fact that her conviction is now sealed. Employers would generally not be able to see the existence of that record, even though the Board of Pharmacy has the ability to see it and understand that it's there. DEA would see it, law enforcement would see it. We have seen an instance or two where someone was working in a pharmacy with access to controlled substances where the DEA became aware of this, and it had some significant consequences for those pharmacies.
All right, and there's a couple of other DWIs from 2015 and 2018. Usually if there's more than one DWI on the record, does that give staff a reason to pause or deny an application?
Yes, anytime that we see someone has had multiple instances of either drug charges or DWI, boating while intoxicated or under the influence, motor vehicle or boats, we generally do also take pause with that. We will often ask for any type of recovery records or potentially ask for an evaluation through one of our inpatient facilities to determine if the person has an addictive disease or issue that would prevent them from being able to work in a pharmacy.
And from the records that Ms. Thompson presented, the first DWI was from 2015 and the second one was from 2018. Is that your understanding?
That is correct.
Okay. All right, anything else you want to present that we have not gone over?
Not at this time.
As the witness.
Thank you, Ms. Mills. Ms. Thompson, would you like to ask the director any questions?
Not that I can think of.
And keep in mind, it's not going to be held against you one way or the other if you do or you don't. It's just that I have to give you the opportunity to ask him if you'd like. Board members, any questions for the director?
Yes, regarding the DEA waiver, based on sovereignty of federal law, that would have to be taken care of before we could take an action otherwise, is that right?
Well, I'll have to answer slightly differently. We have no control over the waiver process. So we would be unable to tell a pharmacy that someone who needs a waiver can work there because only the DEA could tell them it was okay for them to work. Okay. Hopefully that answers your question.
And then one other question, were these charges or arrests, were these disclosed on the application?
Yes, if you look.
Notice there was an expungement that was acknowledged, but.
If you look under tab 4, which is her application for technician registration on page 2, she did disclose that there had been a record expunged or sealed. She did not check yes on the other boxes. We generally understand that many times legal counsel will tell you that you could answer no to those questions. Only she could answer that because of the fact that it was sealed and therefore deemed to no longer exist. And then you can also see her statement, which is under tab number 6, where she explained to the board subsequently what had happened. Her original application came in March 12th of 24, and it looks like roughly a month later in April of 24 is when she had sent the statement. Usually that's because we receive that information and will request additional documents if the statement wasn't sent in initially with it for an application for waiver.
I have a follow-up question.
Any other board members? Ms. Vales, any follow-up?
Yeah, just one other question for Dr. Curley. So when you look at the application and that question, have you ever been cited, arrested for, charged with, or convicted of entering a plea of a criminal offense in a state or federal court? In your opinion, should she have answered yes to that, considering she has DWI arrests?
Yes, we would say that she should have answered yes to that.
And under the paragraph part 3, isn't DWI listed as an example of criminal history?
It is a specific listed offense. We have had that question over the years that some people would think that a DWI was a traffic offense rather than a criminal matter. So we had included that language many years ago in the application.
And also listed in that paragraph, giving examples of criminal history, does it also list hot checks?
Yes, it does.
And in the records dismissed, Thompson have a hot check violation from 2007.
That is my understanding as well.
That's the only follow-up.
Based on that line of questions, Ms. Thompson, would you like to ask the director any questions?
No, I wasn't aware that I had a hot check from 2007.
That's more of a statement as
Okay.
opposed to a question, but again.
No, I don't
I'm gonna
have
give
any
you-
questions.
Yeah, I'm going to give you every opportunity. Board members, any further questions for the director? All right, if not, thank you very much for your testimony. You gonna switch seats?
No, I'm gonna rest.
You're gonna rest. All right. Ms. Thompson, you're next. So if you would be so kind, go ahead and explain to the board the circumstances, what transpired, why you want a tech license, and then Ms. Vales will probably ask you some questions, okay? All right, go ahead.
I'm not proud of my past. As far as the criminal history background, like I said, I wasn't aware of the hot check from 2007. And when I went to pick up the court documents, I'm sorry, I'm so nervous.
Yeah, I understand. Do what you need to do, but it's kind of a little difficult to hear you.
But I vaguely recall maybe receiving a notice in the mail that I guess I had written a check for something that wasn't aware I had money in the bank to cover, but I went and paid it off. When I spoke with ACIC to dig more into what I had out there, because I wasn't sure if there were more things I was unaware of, they said that it looked like the case had just never been closed, but they could see where everything, I just went and paid off what was due, and then that was it in 2007. So I don't really remember all the details from that. I just apparently didn't have the money I thought I did at one point. The marijuana charge, that's one of my biggest regrets. At the time I was in school for nursing, I have worked as an OB tech prior to that, and that's where I gained a passion for the medical field. I scrubbed into surgeries for St. Mary's Hospital for several years, and I wanted to go back to school and get my nursing license and be a surgical nurse. At the time, I was a single mom about $30,000 in student loan debts, shut off notices, all kinds of things were happening. And I was just approached by somebody that I knew that, they said, well, you can sell this to somebody and whatever you make off of it, just use that to pay it. And I've regretted it since. As far as the DUIs, I'm not proud of them. I don't have a drinking problem or issue. After the second time, I realized that it's not worth it. I don't really even drink anymore. The first one I wouldn't have got. My last husband wasn't the greatest. And so I just decided I need to leave the house, but we'd already been at home drinking and I had a cracked windshield and I was driving at night and an officer noticed and, pulled me over because of the cracked windshield and asked where I was heading to, where I was coming from, what the situation was, if we had been drinking, and I admitted to that. And I was cooperative because I don't like confrontation, so I just did everything that they asked. And then the second time was I lived like 5 blocks from having dinner with friends, and I had changed lanes without using my turn signal, and they pulled me over on a traffic violation, and they asked where I was coming from, where I was going. I had dinner with friends. They asked if I had any drinks. I admitted to having drinks. Since they pulled me over for a traffic violation, they decided to just merge it with my first DUI and not give me a DUI, a second offense. And that's what happened with those. But after all the fines and just the ramifications of all of it, that kind of turned just everything around. I mean, I don't take chances like that anymore. I currently work for a mail order pharmacy and I really enjoy my job. And I could go back to nursing school, but after 5 years, you have to start over with all your sciences. And I've already done that. And I don't want to go into more debt to just start all the way over. I worked in optical care. I like caring for patients. I like helping people. I don't like my 20-year-old self. But I just want a chance to utilize things that I've learned and continue to help people. And just put it all behind me. I fought for so long to just get past it.
Thank you, ma'am. Ms. Vales, any questions?
Yes, I have a few questions. So let's just start with that hot check charge from 2007. You gave us the paperwork regarding that, but you also testified you didn't realize you had that charge. So I'm a little confused because it's according to the documents, you went to court and pleaded guilty and paid off the check. Are you saying you didn't realize it would be on your record?
No, I didn't. I don't remember that happening. I mean, it was back in 2007. I just don't.
But you're not contesting.
I'm not saying that it didn't happen. Like I said, I vaguely remember maybe receiving something and then going and taking care of it. But I'm not saying that it didn't happen. I'm just saying I don't have enough information to give you to explain anything.
Okay.
I just don't remember a hot check from 2007.
Okay. So then let's turn to the delivery of a controlled substance. That's in October of 2012. And you were in nursing school at the time?
Yes.
Okay. And you testified earlier that that was a way to pay off your bills and your student debt?
It was just to get caught up on utilities and bills.
Okay. And how long were you selling marijuana?
That was the only time.
So you sold marijuana one time
Yes,
and just so happened to be an undercover police officer that you sold it to?
it wasn't I guess like a CI,
A
somebody that.
confidential
Yeah.
informant? So usually for confidential informants, there has to be permission, I guess, from a judge for the police to use a confidential informant. And for them to get permission to use a confidential informant, they have to have reason to believe that the person they're targeting or looking at is a known drug dealer. So that's why I'm curious as to how you sold one time and it happened to be a confidential informant. Were you part of a group of people that were selling drugs, or what? Can you just describe that
It
to
may
me?
have been related to the person that had given it to me. I'm not sure.
So the person you got the marijuana from to sell was a known drug dealer?
Yes, he was.
Did he live in the same home with you?
No.
Where were you when you sold this marijuana? Do you know?
I was at my house in Bentonville, Arkansas.
So someone came to your home? So how did they know to come to your home to buy the drugs?
Because we had been in contact discussing it, and I told them they could just swing by and pick it up.
Okay, so this was a friend of yours, or?
It was a friend of a friend.
Okay,
Kind of.
that turned out to be a confidential informant.
Yes, ma'am.
Okay, and so how much marijuana did you sell to this person?
1 ounce.
Okay. And you went to court and pled guilty to that, correct?
Yes.
And you and I have looked, or we've emailed each other back and forth about the paperwork. There's some discrepancy on the sentencing order that listed as a Schedule 4. But the other documents, like your plea agreement and your sealing documents, listed as a 6. But it's your understanding that it is a felony conviction.
Yes.
Okay. And I think the sentencing order is probably wrong, but I'm not going to obviously disagree with the judge that signed it. But it is listed, and you were under the impression that you got 5 years probation for a D felony.
Yes.
Okay. And you completed the terms of your probation, correct?
Yes, ma'am.
Okay. And so you were on probation starting, I guess when you went to court June 20th of 2014. And then in 2015, you got a DWI conviction. Or you
Yes.
were charged with it and convicted in 2016. Was your probation officer aware of the DWI charge?
Yes, ma'am. The morning that I got out of Benton County, I went straight to his office before I went home.
And were there any discussions or ramifications regarding your probation with picking up a new criminal offense?
Because I went straight to him and notified him what had happened instead of avoiding it. He gave me 2 days, like the weekend in Benton County, and said anything, and if anything else were to happen while on probation, then I would catch new charges. But that was because I
told him.
Yeah, because I went straight to him. I was honest with it. It was kind of a warning.
Okay. And do you remember on that DWI in 2015, did you do field sobriety tests?
I did. Yes, I did a field sobriety test.
Okay. And did you take a breathalyzer test?
I did take a breathalyzer.
Do you know what the results of the breathalyzer test were?
I don't recall what it was.
And so in 2018, you got another DWI. Were you still on probation in 2018 as well?
I was off probation by the time.
So you'd been
of
off
that.
probation like a week, maybe? The matter was sealed on September 22nd of 2018. It looks like September 26th, you got a DWI. Does that sound correct to you?
I mean, if that's in the paperwork, I don't really.
Okay. And can you tell us the circumstances around that DWI? Did you take field sobriety tests on that arrest?
Yes, I did take a field sobriety.
And did you submit to a breathalyzer test?
I did.
Do you know the results of that?
I don't recall the results of that.
And you said they charged you with, I guess, 2 DWI first offenses, but technically the one in 2008 was your second.
Yes, ma'am.
Okay. And what, so you, at the time of your arrest for the drug charge, you dropped out of nursing school, is that right?
Yes.
Okay. And so now you're working for a mail order pharmacy?
Yes, ma'am.
What's the name of that?
Infinity Care Solutions.
And are they aware of your criminal history?
Some of the management is aware, yes.
Did they ask you questions about that on your job application or?
No, not on the application, because I don't work directly with pharmaceuticals. I work on the patient. I'm a patient care coordinator. I work on the phones and I deal with specialized medication, aid therapy patients, getting their medications to their behavioral health appointments.
So is your desire to have a pharmacy tech position or registration, is that your request in order to be moved to a different job in that facility or somewhere else?
I'm seeking growth in my position, and I just want to continue to move forward.
Okay. All right, that's all I have for Ms. Thompson.
Thank you, Ms. Reels. Board members, any questions?
Procedural type question
Sure.
or informational only? Excuse me. With her application like it is, can you tell me if it can be withdrawn or is it too late for that to happen?
I mean, that would be up to the board if you wanted to allow her the opportunity to withdraw her application rather than having a potentially negative action on it. The board has offered that to other people. Largely due to there are times when people don't realize that there is this other federal issue. While the pharmacy has an obligation to understand that's there, oftentimes an applicant wouldn't know.
But if I could clarify, Ms. Thompson and I have discussed this. We've emailed back and forth and I told her this would be an issue, but obviously she's allowed to pursue it with a due process hearing, but she knew that there was federal regulations that didn't have anything to do with the Board of Pharmacy that could prevent her from working.
But with a withdrawal, would that prevent or help her if she ever wanted to do? I mean, would it be on her record or anything to prevent her from going to nursing or anything else?
No, the withdrawal itself would not. If the board,
I guess what's the benefits to that is what I'm asking.
you don't get an adverse action by the board denying the application. So if you are answering questions on a future application, have you ever had a license, denied, withdrawn, or denied? You could honestly say no, because you're given the opportunity to withdraw it.
Thank you. I'm sorry about that, but.
Oh, no problem.
So Dr. Curley, you talked about the DEA issue. In order for, it would require a waiver for her to work in the pharmacy from the DEA, correct?
For her to have any access to controlled substances, she would either have to have a waiver or something from DEA saying that she didn't have to have a waiver.
Okay. And so I know it's not a Board of Pharmacy regulation, but the vast majority of pharmacies have controlled substances, which
I can think of maybe 2 or 3 in the state of Arkansas that do not hold controlled substances.
so even though it is a DEA regulation regarding the controlled substances, if we were to issue a permit, a technician permit, we don't really have any control over what pharmacy a technician works in.
We do not.
Right. So no, that was it.
So we're asking her questions.
You are.
Hey, so do you understand what we're talking about there?
I think so.
You do?
I think I'm not 100%, but I think I get
So
most of it.
as I see it, and y'all correct me if I'm wrong, there's no way that we can okay a pharmacy tech license for you because of the nature of what's sold in pharmacies and what they have access to. Rather than you get a denial and you have to go, if you ever decide to go somewhere else, you don't have to put on there that you were denied. It's just all of this is not there. Now we can go through with this and that's fine, but it's going to be there. So that's all I had to say.
So I was just going to say, I'll make a statement, but then I want to ask a question. You know, we know people make mistakes in their past, but because of the DEA issue, do you see that in a lot of ways our hands are somewhat tied?
Yes.
In this situation? Okay.
Because basically, if we gave you a permit, we can't protect the fact that pharmacies won't know that you can't work in there. So we're kind of hurting the pharmacies if we give you a permit and then you don't tell them. Yeah. And I'm sure you would, but it's just, we don't manage every pharmacy you work in. So it'd be very hard to give you clearance here, knowing you have to get clearance from DEA, which is very hard to get from what I understand.
So repercussions on that would not be to necessarily you as much as it would be to the pharmacy for hiring you.
In terms of advising her recourse, if she went to the DEA and got a waiver, then that would change things, wouldn't it?
I think you're asking me that, so I'll try to answer. She can't get a waiver. The DEA registrant would have to get a waiver, and it's only for that registrant under the specific circumstances that they apply. I have seen, I believe, 2 people in the state of Arkansas get a waiver in my tenure with the board. And one of them likely did not need a waiver because they were in a role similar to what she is describing now, where they actually did not have access to controlled substances. We did have one other that I can recall as a technician that was able to get a waiver, which quite frankly surprised us because for many years, the DEA might grant 3 to 7 waivers across the entire country is what we would see or hear of. There could have been more that we're not aware of, but we saw many waiver applications denied due to the previous drug felony and having direct access to controlled substances.
Well, and I wasn't suggesting that it be a largely viable option, but simply to identify what the all courses of recourse could be. However slim a glimmer of hope it is.
It would take the DEA registrant, owners of the pharmacy to actually apply directly to DEA and go through that process, which is a lengthy process as I understand it. Right. But that could be an option that if she were to come back and say, I would like a permit to work in this store only, and here's the DEA waiver that I have, it is a different stance than this.
I have a question. I read your the character reference letters, and they're very glowing, but I'm curious with this conversation, especially since you have emailed back and forth with Ms. Bales, are they aware of the specific type? Because I think both of the letters said that they didn't know what happened, just that something happened. So
They are.
So they know that the DEA would be.
I don't know if they know that the DA
would be the limiting factor.
Yeah.
Any other questions from the board? Why don't we go off the record just for a second here, if we could? Ms. Thompson, the board's between a rock and a hard place. So I don't know what you would like to do here. I don't know if you want to have them proceed, because my guess is if they proceed, they're going to deny you a license. And that's going to be hanging over your head as well, particularly if you have to go to the DEA. if you want to withdraw, you can do that now. You can do it on the record. That way, that millstone's not going to be hanging around your neck. But it's your choice, ma'am. What would you like to do? Do you want them to proceed with a denial, or do you want to try to withdraw? You want a minute or two to think about it, or do you want to visit with Ms. Vales?
I mean, if there's no likelihood of being approved by the DEA, then
Well, we're here. They've got you. So they're either going to move forward with this and make a decision, which is probably, again, I don't have a crystal ball. I'm just basing on the questions that I've heard and the testimony I've heard. I don't have a crystal ball. My guess is they're going to deny you a license. So the question is, do you want to withdraw or do you want to proceed?
Maybe can we take a break?
Yeah, sure. Why don't we get, is that okay?
Yeah.
Board members?
Yes, absolutely.
Minute break and I'll.
Okay.
and then
Thank
we'll
you.
Kick it back off.
On the record, Mr. Chairman, board members, you ready to proceed? Ms. Thompson, you ready to proceed?
Yes.
So during the break, I know you visited with Ms. Vales. Did you reach a conclusion about what you would like to do? Would you like to withdraw, or do you want them to proceed with a decision in this case?
I'd like to withdraw.
You'd like to withdraw? All right. So procedurally, Ms. Vales, does the board have to go ahead and do a motion on that, or do they she's just withdrawing it and it's on the record? Is that sufficient for your purposes?
Yeah, I think that's sufficient unless there's some reason why the board wouldn't accept that. I don't think a motion is necessarily
I can make
necessary.
a motion, we accept it.
Okay, then problem solved.
Or is there a second? All right, all in favor, signify by saying aye.
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 Any opposed? Motion passes. Ma'am, your application is withdrawn. Awesome. Thank you, ma'am.
Good luck, Mr. Hancock. I want to when you're done.
This will be a hot case.
Okay.
And I think plus the other one was a good thing. It's really lovely.
Afternoon's kind of a hot, well, you mean like somebody could get mad and come after us?
Yeah, that's what they're saying.
Clint's got a pocket down from under pen.
Pharmacy in the matter of Jessica Hancock, applicant, case number is 2024-048. For the record, my name is Charlie Moulton. I'll be acting as the hearing officer for this proceeding. I would also take judicial notice of both the statutes as well as the rules governing this hearing, specifically Arkansas Code annotated 17-92-101 at sequence 92-305, 92-317, as well as the Arkansas Administrative Procedures Act. Ms. Vales, would you be so kind as to identify yourself for the record, please?
Yes, my name is Ashley Vales. I'm the General Counsel for the Arkansas State Board of Pharmacy.
And ma'am, I assume you are Ms. Hancock, is that right?
Yes.
All right. And have you ever been, I guess, looking at the order and notice of hearing, you were almost in a hearing previously, but I guess things get tabled previously, is that right?
Yes.
Okay. So I don't know if you're intimately familiar with the process, but let me go through some things and explain to you how the process is going to work out here this morning. As the hearing officer, I run the hearing for the benefit of the board, but it's also for your benefit as well. So as we go through this, if you don't understand what's happening, you have a question, get my attention, let me know. My role as the hearing officer is to run the hearing for the benefit of the board, but it's also for your benefit too. And I want to make certain that you get your story fully told in front of this tribunal. If you're thinking that's not happening, that means I'm not doing my job, okay?
Yes, sir.
So you've received a copy of the order and notice of hearing, correct?
Correct.
And you're representing yourself here this morning, correct?
Correct.
And you are ready to proceed, is that right?
Yes, sir.
Okay, and you're doing a great job so far. Verbal responses as opposed to a nod of the head are appreciated because I have a court reporter right next to me. She's transcribing everything. And it's really hard for her to take down a nod of the head.
Yes, sir.
So if you have a habit of doing that, which some people do, I may stop the proceeding and remind you to give a verbal response. I'm not trying to pick on you.
Okay.
I just want to make certain you get a good record, okay?
I understand.
I've got a number of exhibits. Ms. Vales, how many do you have?
Yes, I'm moving to into evidence exhibits 1 through 15,
All right.
which Ms. Hancock has in front of her.
Ms. Hancock, do you have any objection to the admission of staff's exhibit 1 through 15?
No, sir.
Thank you very much.
In addition, if I could interrupt, I'm sorry. Ms. Hancock has presented some documentation that's been passed out to the board. Some of that documentation is already in the packet as an exhibit by the board, but there are letters, reference letters, that would be her exhibits that aren't in your tablet.
Right. So
And I have no objection to those being admitted.
why don't we go ahead and mark her reference letters as a compilation package? We'll mark that as respondents exhibit 1 or applicants exhibit 1 and go ahead and admit that in evidence as well. Ms. Hancock, besides yourself, did you bring anybody here with you this morning?
My sister's out in the lobby.
Do you want her to testify here this morning?
No, I'm good.
Okay, just in case.
Yeah, I'm
I don't
good.
know if you had somebody out in the lobby waiting for us. Just one witness, Ms. Vales?
Yes.
All right. Ladies, would you be so kind as to raise your right hands? Do you swear or affirm the testimony you're about to give in this hearing is going to be the truth, the whole truth, and nothing but the truth?
I do.
Yes.
Thank you very much. All right, so how the process is going to work, Ms. Vales is going to ask Dr. McCready some questions. Because you're representing yourself here, you have the opportunity to ask her questions as well.
Okay.
You don't have to. It's not going to be held against you one way or the other.
Okay.
It's not court TV or anything of that nature. The board asks questions. They have the opportunity to do that under the APA. After Ms. Vales is done, I'm going to turn it over to you. You can provide a statement to the board, explain to the board what happened, and then why you want a tech license. And then after you're done with your explanation, Ms. Vales will probably ask you some questions. The board's probably going to ask you some questions as well. Once all the evidence is in, we go off the record, they deliberate, then they come back on the record and they announce their decision with a motion and vote. Okay?
Okay.
All right. Ms. Vales, opening?
Yes, please. Just for a little bit of background information. Ms. Hancock appeared in front of the informal review committee on April 2nd. And the committee's decision after hearing all of the evidence was to take no action on her application. And she is appealing that decision to the full board. So that is why Ms. Hancock is present today. The allegations and some of the information that we reviewed at the informal hearing are now contained in the order of notice of hearing, which we will need to make findings of fact and conclusions of law on this morning.
Well, thank you, Ms. Vales. Ms. Hancock, it has been my experience after doing a few thousand of these, that when somebody's representing themselves, their opening statement is exactly what they're going to tell the board during their case in chief. So with your indulgence, I'm going to ask you to waive your opening, but I'm going to give you every opportunity to tell your side of the story. Okay?
Okay.
I appreciate it. Thank you. Ms. Bales, call your first witness, please.
Dr. Brenda McCready. Dr. McCready, staff had reviewed Ms. Hancock's application for pharmacy technician registration. And why was the decision made to route her application into the informal review committee?
There were several incidences of domestic issues. There was an arrest on November 9th, 2011 for public intoxication, terroristic threatening in the second degree, which was a misdemeanor, disorderly conduct. She was convicted of disorderly conduct. The other charges were dropped. On December 27th of 2018, she was again arrested and charged with first-degree assault on a family or household member. That was a misdemeanor. She did plead guilty and was sentenced to 12 months probation, some court costs and fines. That charge remains on her record. And then again, on October 19th, 2022, she was arrested and charged with battery in the third degree, another misdemeanor. She pled guilty and was sentenced to fines and court costs and 1-year probation. At the time of the previous application, she was still on probation. She has completed her probation as of November 9th of 2023. Staff felt like the decision to grant the application could not be made at staff level and it needed to come before the board.
And so she appeared at the informal committee meeting in April of this year, correct?
That is correct.
Do you recall the action that the informal committee took?
They just tabled the application at that time.
They took no action?
They did not.
Okay. And Ms. Hancock is appealing from that decision. Is that your understanding?
That is correct.
Okay. And in her application, did she disclose that she had been arrested,
She did.
charged, or convicted?
She disclosed that she had been arrested, charged, or convicted, and she also disclosed some treatment or some drug or alcohol addiction or some sort of treatment in the last 5 years.
Okay. Anything else you want to add with regard to Ms. Hancock's application?
That would be all.
Ask the witness.
Ms. Hancock, would you like to ask Dr. McCready any questions?
No, I'm good. Thank you.
Ma'am. Board members, any questions? Yes, sir.
Just for my help here, would y'all give me the definition, if you would, of like the charges? Kind of tell me what they mean.
Yeah, so public intox, terroristic threatening, public intox, obvious, terroristic threatening, she wasn't convicted of that, but that sounds more ominous than it is. It's just you threatening bodily harm to another person. It's a misdemeanor violation. She was arrested for that, but not convicted. Then first degree assault on a family or household member, that is one of the offenses. Any type of violence with a household member falls into the category of an offense that you can deny her application under. But that would be maybe some sort of bodily fight or something like that, but not necessarily an injury. Or like if I threw a hammer at your head, that's assault. Not saying she did that, but that's an example.
What was the Indian?
Oh, misdemeanor.
Okay.
Yeah. So yeah, the terroristic threatening was a misdemeanor, not convicted of that. Disorderly conduct is the lowest level of misdemeanor. Public intox, lowest level of misdemeanor. The first degree assault would be an A misdemeanor, which would carry up to a year in jail and $1,000 fine. She got 12 months probation for that. And then the last one from October of 22, also battery in the third degree, there would have to be some injury finding for conviction of that. And that's also an A-level misdemeanor. So that also carries up to a year in jail and $1,000 fine. She got 1 year probation on that, which she just completed in November of last year. So MM is misdemeanor.
Thank you.
Any other board members?
Why do you want to be a pharmacy technician?
Hold on a second. You're jumping ahead, Dr. Newsom. We haven't gotten to our statement yet. Any questions for Dr. McCready? If not, it's your turn, Ms. Hancock. Would you be so kind as to explain to the board what transpired, what the history was, and then, as Dr. Newsom just alluded to, why you want a tech license?
Okay,
Go
so
ahead.
let's back up a minute.
Sure.
So the dates are wrong, not saying that the incidents are wrong, but the dates are wrong. So, let me grab the letter here. It states that the November 9th, 2011, that was the actual, but it says on December 27th, 2018, I was arrested. That's whenever it was finalized. I was arrested in September of that year. And 2018 is whenever I was charged, and I did a year probation, and I paid a fine. So actually my probation was over whenever like COVID started. And then I was also arrested September of 21, and I didn't even have probation. I just paid a fine, and everything was finalized October 19th of 22. I didn't do any probation whatsoever on that. So that was not right. So whenever I started in Walgreens, then that's whenever I needed all of my documentation. So that's whenever this last documentation on the back page of what I gave you, that's whenever I had to go get my final paper from the, it says Arkansas Community Corrections. That's whenever I had to go get that finalized paper showing that my probation was over from the 2018 arrest. So that's where the November 9th thing came from. So yes, I can't say young because I was in my 30s, but I was just, I'm going to say young, and I had had a little bit to drink, and I let my, I guess, ego get into it with a female that wanted to run her mouth. And yes, so that's what happened with the first incident. The second incident, I had an abusive husband, and we had an altercation. And so we were both arrested for that one. And the third incident, then another female, she had stolen some stuff from our house. And whenever I seen her, then she started the altercation with me, and I was defending myself. So that's what happened there. And I don't have anything other than that's my past. I moved away from that area. I no longer have anything to do with anybody in that area except for my kids and my dad. I now live in Crawford County, and I literally go to work and go home. I married my high school sweetheart, and we have a new life, and everything's wonderful. I love Walgreens. I love my job. I've never, ever, ever understood why people say, oh, I love my job. I love what I do. It's not even work. Now I do. I get it. I love my patients. I love getting up and going to work. Whenever somebody calls in sick, that's what I do. I love it. Everybody knows me by my first name, and people come in and ask for me whenever I'm not there. So to me, that's not a job. It's fun.
All right, thank you, ma'am. Ms. Hales, any questions?
Yes, so what do you do for Walgreens right now?
Right now, I'm a pharmacy cashier.
Okay. And you're talking about patients. You're not working and doing pharmacy tech position.
No, I'm just the cashier.
Okay. All right. And so some of these charges, at least you had one arrest for public intox. Was alcohol an issue in all of these arrests?
No.
No, so some of these arrests for assault and battery, were you sober or under the influence of anything?
No, sober.
Sober? Okay.
Yeah.
And so on your application, you marked that you'd had some kind of treatment. Is that treatment for any drug or alcohol issue?
No, ma'am. It was, they counseled me to see if I had any alcohol or drug problems, and the answer was no.
And who is they?
No, it was the OGC. Ozark Guidance Center.
Yes. So did you get a referral to there yourself or did the court refer you to them?
No, the court, they wanted yeah, I guess it was a referral. Yeah.
So was that in conjunction with one of these arrests?
Yeah, the second one, the one with my
The
ex-husband.
2018?
Yes, ma'am.
The assault on a family or household member?
Yes, ma'am.
And who was we pled guilty to the charge. Who was the other person involved with that charge?
My ex-husband.
Okay, and he lived in the home with you at the time?
Yes.
What happened?
We got into an altercation. He shot a gun at me, the back of my neck. I smashed I hit him with a hammer in his pocket because he had a methamphetamine pipe in his pocket, and I smashed it in his pocket. And I got shot in the back of the neck.
So why then did you go and plead guilty to that?
Because that's what my lawyer, my public defender told me to.
And did you tell them that, I mean, you had a gun to your head?
Yeah, it whelped the back of my neck, yes, ma'am.
And and nobody talked to you about maybe self-defense or any defense like that?
No, ma'am, and that's exactly what the judge told me. She looked at my lawyer like she was crazy. But I wanted to get everything done and said and over with and behind me, just like the third one. I wanted to get it all done and
So
said and over with.
a misdemeanor, you can plead guilty for whatever reason, I guess you want to, because it's not a court of record, but that was your choice to take the probation?
That is correct.
Okay. And then the October 22, and I've got arrested and charged because sometimes the dates on the documents don't list arrest dates, but battery in the third degree, also a misdemeanor. Was that involving your ex-husband as well?
No, ma'am.
Who was that involving?
That was involving a female that lived in the Fayetteville area.
Okay, and what was your relationship?
I don't have a relationship with her. She was just.
How do you know her?
Who
was she?
She was somebody that stole some stuff off of our property at the time.
Okay. And so did you call the police?
We did.
When she stole the property?
We did.
And what happened at that point?
Nothing. And we actually ended up getting the stuff back because we had it all on camera. And then whenever we seen her at a mutual friend's house, then she came up to me and she confronted me and she ended up jumping me and I just defended myself. And then she ended up going to the hospital and claiming that me and my boyfriend at the time jumped her, which was not true. But if you look at the other documents in there, it shows that the prosecutor says that she ghosted him after I pled guilty.
Right, but then what, okay, that also sounds like a matter of self-defense. Did you raise that with your attorney?
There was nothing that I could do because that's what they said to do. That it was better to plead guilty and have it said and done than to drag it out.
Okay.
And that was a paid attorney. That wasn't a public defender.
Okay, well, I mean, so their advice was for you to plead guilty to something that you still to this day don't feel like you're guilty of and take probation again.
That
Is that a
correct.
fair statement?
Yes, ma'am.
Okay, and all these charges are on your record.
Yes, ma'am.
And when we ran your record, they're still there. But you're contesting both of those. For this purpose of this hearing, you're saying you didn't do those.
Yes, ma'am. I'm saying that they were both self-defense. Yes, ma'am.
Okay. All right, and some of these exhibits are already in the packet, but you've got letters from several people. Who is Stella Kawemo?
She is the pharmacist. We don't actually have a pharmacist manager. She is the pharmacist that's there 90% of the time at our Walgreens.
Okay. And is she writing this? She's just writing this as personal recommendation, or is she representing this as the opinion of Walgreens?
I don't know. You'd have to ask her. That's just the one that she sent for me to hopefully in hopes of me getting my license.
And is this person, Stella, I'm gonna butcher her last name, I don't know it, but
I'm not sure how to say it either. I'm sorry.
does she know, I mean, she talks about your work ethic, I guess, but does she know about your criminal history? That's also,
Yes, ma'am.
you've told her that?
Ma'am.
Did you tell her that at the point of, is she the one that hired you?
No, ma'am.
Okay. Did you tell Walgreens at the time that you were hired that you had this criminal history? Or was that even a question on the
They
application?
ran my background.
Okay.
It came back on my background. And the previous, my first court that I had here with y'all, Jessica, my RXOM manager, she wrote a letter, and that should be in all of this first book, I guess. But she had written a letter and stated how she thought I should have it. But she was my hiring manager.
Okay. And was that a personal recommendation for her, from her, or?
I think it was
is
both
this-
personal and professional.
So she's speaking on behalf of Walgreens as well?
Yes, I do
Okay.
believe so.
All right. And then you have a letter from Jose Aguilar. He's a pharmacy technician that you work with, correct?
ma'am.
Okay, and that would be a personal recommendation, I suppose. Okay, and then you have one from Miss Hernandez. Who is she to you?
She is pharmacy tech. All of those letters are from people that I work with.
Okay. They're working as a pharmacy tech. You're working as a cashier.
They're back there. Yes, ma'am.
Okay. Same for Catherine Smith.
Yes.
And how long have you worked with these?
I got hired in October and all of them were already working there.
Okay. That's all I have for Ms. Hancock.
Thank you, Ms. Vales. Board members, any questions? Everyone's quiet this morning. Wow. All right, no questions. Oh, I'm sorry, Dr. Davenport.
So what would you say has changed between the time that you were struggling with these relationship issues and now?
Moving out of the area was a big thing, getting away from things. I struggled with I had a lot of personal deaths, and I think getting away from that area and the people that I was hanging around with and just focusing on myself really helped me a lot. And right now, just being me and my husband and our 2 dogs, I think that's what needed to happen for me to focus on myself.
Any other board members?
You mentioned a meth pipe at one point. Were there drugs involved in these
Yes, my
instances?
ex-husband. Yes, my
But you
ex-husband.
personally
No,
didn't take any drugs?
How do you deal with anger now? Seems like you had a lot of anger issues. Yes.
I don't have a lot of anger anymore. I used to, like you said, but I don't have a lot of anger anymore because I'm not around anything like that anymore. I'm not around the things that used to stress me out. You kind of get yourself out of that pocket and you don't experience that stuff anymore.
Any other questions from the board? If not, Ms. Vales, would you like to have a close?
I'll waive closing.
I'm sorry, Ms. Vales?
I'll waive it. I'm sorry.
waive
Yeah, I'll waive
close?
closing.
Anything you would like to add, Ms. Hancock, before I wrap this up?
Either which way, I'm probably going to cry because I really want the tech license, but I understand either which way, but I do appreciate you guys taking the time to listen to me, to have me back here. I do appreciate it.
Thank you so much, ma'am. At this point in time, I call the evidentiary part of the record to a close. we're going to go off the record. The board's going to deliberate. Once they reach a decision, they'll come back on the record and announce that decision with a motion and vote. We are off the record. Mr. Chairman.
Thank you. So any discussion? What discussion?
I guess I did have one question. Is there a recommendation from the board? I didn't.
We have to go back on the record to get that.
Can we go back on the record
Yes,
and ask
please.
that? All right, we're back on the record. The board has one question.
Yeah. I, oh, sorry.
There's no record of the question. Could you pose the question
Oh, yeah,
again?
I'm sorry.
The question is there a recommendation from the board based on your assessment of the evidence?
Staff would recommend denying our application due to the level, the offenses that involve violence. I think the board informal committee was concerned that there hadn't been enough time, that she sort of completed probation. Usually I've seen it where you all want to wait a little bit to see how she does without kind of any kind of supervision. But we're concerned as a staff that she has some violent convictions. As she presents here today, she's sort of not taking responsibility for those, even though she did when she went to court. So, and as you're aware, she's describing these events as stress-induced. Putting her in a pharmacy as a pharmacy technician is only going to add to that. And wouldn't be necessarily a situation where if she got stressed, she could just simply walk away from that without, messing up her job. So we're concerned about that. And that's the reason we would recommend a denial of the application.
Thank you.
Ms. Hancock, do you have a response to that on the record? Would you like to respond to that?
Yes, I would. Like I said, I don't get stressed like I used to. I don't have that tendency anymore, at all. Whenever I'm at work, I mean, I'm happy-go-lucky. I don't have a bad day at work. I'm not like the person that I used to be at all in any sort of way. I mean, everybody asks every single time I'm at work, do you ever not smile? Do you ever have a bad day? So that's not me anymore, but I understand how she feels, so.
Can I ask her a follow-up question? Sure. Okay. So what was your employment history before, like during all the time that this was happening? I know we're probably talking about a pretty wide range, trying to remember the dates, 2011 to 2022, but especially the ones, more recently, did you work somewhere?
Yeah, my ex-husband and I worked for his family at a family car business. They own Lincoln Auto Auction back in Northwest Arkansas, and I worked there from 2004 up until 2018.
Okay.
And that's what we did. And then I also worked at Macadoodle's liquor store from 2015 till 2017. And then after that, I didn't have a job because I was going through so much stress-wise. And so it was nothing until I moved down here. And then I went to work for Walmart and then Walgreens.
Okay, thank you.
Before we go off the record again, any other board members, any questions? All right, we are off the record.
Okay. Anywhere, go ahead. Start with you. Okay. Debbie? No, can we move that way? You still thinking?
Yeah.
Rodney? Okay.
But the reasoning. I think she's going to. The situation. I think that was a big.
Thank you. Okay. Any other discussion, or is someone willing to go back on the record? Are we ready to make a motion? Okay.
All right, we are back on the record. The board has reached a decision in this matter. I'll turn it over to the chair for a motion and vote, Mr. Chairman.
And we do have to come to a conclusion on the allegations and charges.
Allegations and conclusions. I mean, you can come, you just have to include it in the motion. However you want to parse it is fine.
Go ahead.
I have a motion. In the matter of Jessica Hancock, case number 2024-048. Hope I don't get this backwards, but all the allegations have been proven. The charges
Might be vice versa.
wait, was the allegations proven?
True.
So the allegations are true and the charges are proven. And in lieu of that, I move that we accept her tech application to be a pharmacy tech.
Okay, so we have a motion on the floor to grant a waiver and approve. Second from Mr. Simpson. All those in favor?
Aye.
Any opposed?
No.
Motion passes 6-1.
All right, I'll ask staff to reduce that decision in writing. Make certain that Ms. Hancock gets a copy of it along with an information sheet or letter. Under the law, they've got to tell you what your appeal rights are, but since you're getting your license, I sincerely doubt you're going to appeal, but that's required under the law. Any further questions or comments from the board before I shut this down? If not, you're off the record.
Thank you. Thank you so very much.
Good luck.
Thank you. So am I good to go?
Or before it's done.
It's just that it's good. Just now wouldn't.
Okay,
All
Dr.
right.
Kirby.
We've got Brad Lawson with us this morning under tab number 6. I will try to kick this off. I think most of you guys know Brad already. We have an odd situation in the small town of Ashdown, Arkansas, where there had been 3 pharmacies there. We had Brookshire's, Walgreens, and Walmart. And Brad will correct me where I misspeak. I always point that out for folks. And when Brookshire's sold over to Walgreens, Walgreens made efforts to try to keep both that Brookshire's open to help with the grocery store itself, as well as their main location. But staffing has become quite an issue in that area of the state. There just are not pharmacists working there. Most of the pharmacists that are working that area, it appears, are even coming from other towns. Working through some intermittent closures of that store that were outside of their normal expected hours, we've had some discussions with Walgreens, and they'd requested for a reduction in hours below 40 hours a week. Our typical response to that, or the way that we've handled that for many years from the board staff side, is, well, we have given reductions in hours for stores that are in places where otherwise we create pharmacy deserts. So we've got little towns. I know Dr. Krause has experienced some of that with like Portland, where if that store didn't have reduced hours, there's not a store for many, many miles. We've done that with Bearden, Arkansas. We've had a few locations. Junction City, I think years ago, may have gotten that. But if there's a a location where there are other pharmacies within, and generally we say 10 miles, kind of like pickup stations, but within the same town, you don't give that type of a competitive advantage where someone else is able to operate under 40 hours. This one is incredibly unique in two ways. First of all, 2 of the 3 stores in that town are actually Walgreens stores, and they came to us with an approach of how they would try to keep both of them open reduced hours. Otherwise, it's you either lose a pharmacy in the grocery store, which could harm the grocery store, or you lose the standalone store, which is actually the higher volume of the 2 stores. And Brad can tell you their numbers because I would misquote it. This is interesting because they actually proactively reached out to Walmart, who has the other store, and said, look, there's this issue with the Board of Pharmacy. They generally will not do this. Does Walmart have a problem with us getting reduced hours trying to keep these 2 stores open and staffing? And Walmart not only told them that, they actually had a discussion with us of, we do not have a problem in this situation with you helping to keep those stores open with reduced hours, whatever we need to do to make that official. I said, well, you've called our staff and we've had this discussion. I approved it on a temporary basis as presented. Because we were basically telling them either get your stores open or just close them completely, which I know got everybody's attention. We kind of have worked through this process, and I believe it's a temporary thing, but I'm going to let Brad kind of speak to what they're doing and what's going on, and you can probably address kind of the volume of the stores.
Nicole Cover should be on
Nicole Cover
Zoom.
also on Zoom with us to back up Brad in case anything else happens on a higher Walgreens level for questions.
Yeah, good morning. Yep, I am here, and I plan to just be here in a supportive role, as I did have some of those conversations that John very distinctly talked about with the competitors and such. So here to support if there's any additional questions on my side. Thank you very much for this opportunity.
Thanks, Nicole. Brad?
Good morning, board. Good morning, staff. Appreciate you guys. First and foremost, I want to start off with a big thank you to specifically the staff and the board over the last couple of years. There's no doubt that there's been a lot of strain put in community pharmacy since COVID, and then different staffing situations, and just the grace and support that's been provided to our profession in community pharmacy is greatly appreciated by you guys. Specifically here, the 2 stores in questions are Walgreens 15790, which is a previous USA Drug, small format location in Ashdown, Arkansas. And then, as Dr. Kirtley mentioned, the Walgreens 21500, which is inside of actually a Super One, Brookshire Super One. They're the same company. So it's a Super One grocery store in Ashdown. They are located in Little River County, which, according to the data that we received previously from the board, there are currently 8 licensed pharmacists in that entire county. Dr. Curley brought up that there's 3 pharmacies, including Walmart, in Ashdown. I have spoken with Walmart leadership and expressed to them, the situation we have at hand, and our want to not negatively impact their pharmacist and their team with patients' care because of an influx of business going to one store or another, because I know what that can do to surrounding locations and the engagement and potential burnout of pharmacists there as well. One caveat that is unique to Walgreens in this county is in Ashdown, we are the only pharmacies that accept TRICARE insurance. So our veterans, unfortunately, would have to seek services and care outside of Ashdown if we were to, unfortunately, not be able to stay open and service them. Another situation, just kind of lay the groundwork of, the rural market there and the staffing situation at hand. There was a recent closure announced in Miller County. Is that right? Yeah. Miller County, right outside of Ashdown in Texarkana, Arkansas, specifically because of the inability to staff that pharmacy. So there's another independent pharmacy that's closing this week because of staffing. And that's what we're trying here to prevent. Not only the effect of public health, but also, the team members that, work there, the pharmacists, the technicians, the entire staff. So we have had extensive turnover in these 2 locations as of late. So Dr. Curtley talked about the transition from Brookshire Super One to Walgreens. That was around August. The pharmacists that were previously at that location before transitioning to Walgreens left the company. We had pick that was in place out of Texas that was supporting that location when it transitioned over to Walgreens. And then that's the 21500, the Super One location. And then Walgreens 15790 has had zero staffing issues my entire tenure with Walgreens. They've had a very strong, dedicated team committed to that community this entire time. The staff pharmacist I actually graduated pharmacy school with, and she's been working transition from USA Drug to Walgreens that entire time. She recently moved to Texas about a year ago and has been commuting an hour back to Ashdown to, once again, service that community. So she was looking to get somewhere closer to home, and she actually stayed with Walgreens in New Boston, Texas, is where she's currently located, which is a little bit away from Ashdown. The second staff pharmacist we had there, she was kind of a PRN pharmacist. She has been practicing for a number of years. She served her time, and she's actually retiring from practicing altogether. The pharmacy manager that we had at 15790, we were told that she was leaving to take a position in a hospital. So that dissipated our entire work staff at that location. From a support perspective, things that we're doing to help these locations in the meantime, even before the hours reduction request with the board. So we do have staff, like Dr. Curley mentioned, from surrounding areas that are coming in to support this rural market. So we have pharmacists from Little Rock, from Jonesboro, from Fort Smith that are even coming down. But we've increased our headcount of pharmacists in the greater Central Arkansas market. They've been able to support. We've also increased our headcount in El Dorado to kind of come from the southern part of the state to support. So it's all hands on deck support of this smaller community in southwestern Arkansas. We're also currently utilizing the centralized services pharmacy that we have here in our area office in Little Rock with providing offsite data entry and data support. So these stores are currently being supported out of the pharmacy right there by the Heart Hospital. We also are utilizing workload balancing, which is where other pharmacies can support with data entry and data review for that pharmacy. So trying to provide them as much service and support as we can, not only for those team members, but for those patients outside of, the four walls of that store. We do have some hope on the horizon. Pardon the pun, but we did hire a new grad in Hope, Arkansas, and Hope is relatively close to Ashdown. So we're excited to see the support that he's going to be able to bring in. That when we help one store in that smaller market, it really helps all three stores because we're all kind of sharing support, even though it is, a little bit away from Ashdown. With the recent announcement of the independent closing in Texarkana, Arkansas, we have approached the pharmacist at this location to offer them positions within Walgreens at Ashdown and at Hope. So we have some good support there that we're hoping to come to fruition so we can provide employment for these pharmacists, but also support for our patients in that community. And I think that the board has mentioned, the sports staff's mentioned previously that, due to a lot of the support that we've been doing behind the scenes, they've seen very minimum board complaints come through about this specific store and the unexpected closures that we've had over the last few months. So our specific request today to the board that was approved previously by Dr. Curley was to resume hours of operation open to the public less than 40 hours a week, or each location will actually be open 30 hours a week. We had a rotation approved previously where they were kind of flip-flopping stores every other day. So one store is open Monday, Wednesday, Friday. The next store is open Tuesday, Thursday, Saturday. Since we've made that transition and we're hearing from the patient population that this may not actually be the best schedule for them because it's hard to keep track of which stores open on which day. So we're actually requesting a little bit different deviation to that request, where we are requesting Walgreens 15790 to be open Monday, Tuesday, Wednesday. So kind of like a block at a time, Monday, Tuesday, Wednesday from 8 a.m. until 6:30. The pharmacy and the pharmacist and pharmacist team members will be taking a lunch break between 1:30 and 2. So we are open 10 hours a day, 3 days a week. And then Walgreens 21500 in Super One will be open Wednesday, Thursday, Friday, same hours, 8 a.m. to 6:30 p.m. with that half an hour lunch between 1:30 and 2. This does provide 2 stores open on the same day and Wednesday. So one day a week that we're able to support each other and flex in a different way in that manner. And just like Dr. Curley mentioned, this is a temporary request. So we're not asking for permanent hours with this. Our goal is to get our stores back open to appropriate hours so we can support that community in the way that we intend to.
Do you have a timeline for when you think you might be able to?
It depends on NAPLEX testing in part of when new graduates get licensed and then can move around some pieces.
Brad, I'm not looking for a specific date, but just a general 6 months, 9 months. What are you thinking?
So if we had to put a date on it, the request I would put would be 12/31 to 25. But if I had to go shorter, then we could potentially talk about something shorter. I mean, obviously, anytime we need is going to help, but we do have some plans in place, especially with the new grad and the 2 new pharmacists from the pharmacy in Texarkana, Arkansas, that would be able to provide immediate assistance upon licensure and accepting employment.
And the board, if the board entertain and approve this, I mean, your choice is either approve it or tell them choose a store to keep viable and close the other one. You could also ask for updates as to any progress. It wouldn't have to be a full report, but just a written, update how it's going, if they need tweaks to it. I mean, the good thing is, of course, you may be mad at me for approving it as the director on a temporary basis, but now we know that the original way wasn't the way the community wanted it. And I will point out that because these are shared database, they can still serve customers, patients from the other pharmacy because they have full access to the cloud-based system. The last thing I want to say is the old Brookshire's 150 a day, 170 a day or something, and then the main store is double that?
About, yeah. Is that about right, Blake? So I have Blake Crabtree. He's our district manager for this location, oversees the operations for this market. He's more well-versed in that, but I think that's pretty close to being right. Yeah. Yes.
So we're looking at 30 hours a week for each store?
Yes, sir.
So if a prescription's ran at one location, you're open at the other location, are they able to reverse that off of insurance and fill it at the other location?
Correct. Yes, sir.
I have a question for Dr.
Yes,
Curley.
we all do.
I understand we're doing this because this is a temporary reduction below 40 hours a week.
Yes, sir.
Okay. How would you compare and contrast that to the recent action that Walgreens took at the Mississippi and Cantrell store?
They closed it completely.
So when you say closed, you're talking about you closed just
The pharmacy itself. So Walgreens did close 5 locations throughout the state of Arkansas that they closed the pharmacy parts of those businesses. My understanding, and I think Brad will agree with this, is the hope is that at a future date, they would have the staffing to fully staff all of those locations and repopulate those pharmacies. But for now, they kind of fell back onto themselves of seeing where there were places that they could close a pharmacy location to better staff other ones to be able to fully support their patients.
And does the board play a role in either the closing or the reopening of a pharmacy?
We get the notification of the closing, and we've worked with different pharmacies that if, the day they're going to quit operating and giving them the space and the time they need to then clean out the pharmacy itself so that it's just a shell, not a shell full of medications. And then when it's reopened, they have to have an application in 30 days ahead of the intended opening. And if need be, we would go and re-inspect the location. Since these are locations that have been inspected many times, we may not even need to inspect that location because we have seen it so many times.
Well, I understand the board is involved here with this issue because of the reduction between the required 40 hours. Would the board be involved in any of these other things such as a closure or a reopening?
No, sir.
Okay, thank you.
Is this the same area that we, within the last few months, had a discussion about hospital coverage and somebody having?
It was a critical access hospital in Ashdown. Yeah.
So I really appreciate Nicole and Brad for actually coming before the board, not even just coming here today, but talking to y'all ahead of time and trying to work through it. And you feel the need to keep them both open because different people prefer to go to different locations, even though it's in the same small town, because one's busier and then the grocery store isn't as busy, but they buy their groceries there.
If you close that pharmacy and that grocery store, you might lose your grocery store.
Right.
And the grocery store, and this is just from my perspective,
Right.
having seen many of these, the grocery store is not built for the volume of what both stores would have. And the other store is, I mean, it might be able to handle the volume, but then you
Doesn't
still
have a
risk
grocery store.
the grocery store.
I mean, I feel like it's admirable that they walked in and shared the issue and are working through it. I don't really have a problem with it. I know this will potentially bring up additional ones and additional areas that we may end up with the same type of question, but I guess we could look at them, you know, if they make
It's
sense.
a one-off issue.
Yeah. I feel like this is kind of unique, so I feel like they've done the right thing.
Yeah, Board Member Mack and Mr. Director Kirtley. The only thing I would add there is absolutely, I agree with everything you've just said. It is a unique situation and it is a buy and operate as a part of the Brookshire company. So you have a Walgreens owned pharmacy and still a Brookshire owned grocery store. So there are some contract issues. So we are actually, being a good community partner with them as well for some of the requirements along with that purchase agreement. So we're really trying to protect them as well because it was just an unintended consequences that had happened. So I can assure you that, we are offering the best solution that we have, and we do appreciate the continued partnership. And I know the other pharmacy member, when I reached out to them, really was complimentary to us just in general of being vulnerable and kind of sharing the situation we were in, and that we didn't want to just offload volume and create a bad workplace for, their one pharmacist that's at that location. And so from a protection of public health and safety, we gave the best viable option, and really appreciate Brad and his team for the boots on the ground of all the things that they're doing to put the public health and safety first. So really appreciate the opportunity to present.
So with the approval today, if the board chooses to approve this, would it be for a temporary with an indefinite, or is this permanent? What is our?
It's up to you.
consideration?
The intent is for it to be temporary, as you've heard from both them and us, because it's a town with multiple pharmacies, especially. But you can set whatever time frame that is. You could say you could do it board meeting to board meeting, but if you at some point are going to tell them they have to be back at 40, they need some notice. So if you say, hey, if you can say, we'll give it until a month after the October board meeting, or we could do it through the end of 24, whatever you want to do, but please just give them notice before you say all of a sudden tomorrow it's back to 40.
Have we approved reductions for the same reason though?
Never.
As permanent? Never?
No, well, as permanent, yes, but it's been in towns where there was no other competition and we were preventing a complete pharmacy desert. So we've got 4 or 5 pharmacies that, Dr. Krause has a couple of them, but there's nothing within 17 miles one direction and 15 the other. And
Well, this town that we're talking about here is about 4,000 people.
yeah, it's small.
And so you've got 2 Walgreens and a Walmart and a Brookshire's for grocery store. And I'm sure the Walmart has groceries.
Yeah.
And then there's probably some convenience store groceries, but if I could ask, can I ask how many prescriptions you're filling roughly?
Sure, that's what we just, so it's anywhere between 100 to like 150 a day, if that at
In the
Brookshire's.
Brookshire's?
Yes, sir, at the super one, yes, sir. And then around, 250 to 300 at the other Walgreens location.
I recommend, if we're talking about what to do or whatever, my thought is give him a couple of chances. I say, because if you did it from a year from now, they're going to be able to basically look at this groups of graduates. And if they don't get any of them, then they have to see if they can find somebody that wants to move to Ashdown. But then if you pushed it to say July or August, a year from July and August, you'd give them this year.
Plus NAPLEX time.
Plus next year.
Yeah, plus time for them to pass their NAPLEX.
Yeah. And then after that, you need to combine your stores.
Just.
They may have an opportunity that can, another I mean, everyone knows that you may be staffed today, but then tomorrow it didn't. So it's real hard to put a date on it, I think, but I think that makes sense to make it bigger.
Since we're talking about Naplex scores, not to shamelessly take a plug, but just want to remind you, this is the first year that Harding will be graduating their entire class in December. So we have a couple of 6-month timelines that maybe, you know, they can make a targeted effort to try and recruit at Harding between now and December. And then at UAMS then in May. So there's a couple of different timelines that might provide you some opportunity to get some people.
Have y'all already switched to the Monday to Wednesday with the Wednesday crossover, Wednesday to Friday?
No, so the schedule that was approved by the board was the every other day. And so that's what we've been running, because that's the specific schedule that was approved by the board staff.
Got it.
The executive directors.
Saturday issue, like it's hard to find staff on Saturday. Is that the reason to go to 2 on
Right.
Wednesday? Yeah.
Do you have,
So
oh, sorry. Do you
It's
have
been
like
going for like 3 weeks.
a procedure in place for, so if I'm thinking of this from like a mom perspective and my kid gets an antibiotic called in at 5:45 at one look, like, do you have procedures in place at these 2 stores automatically so that like the patient isn't having to be like, oh, hey, I need to call in and tell you that I'm going to be picking it up at this other store in 2 days, just logistically?
So are you discussing informing the community of the change in
No, like
hours? Is that
when,
what you're
like,
saying?
no procedures, like workflow procedures for addressing where someone is picking up, particularly if it's towards the end of the day or I guess on a Wednesday evening or you know what I'm saying? Like verifying that they're getting the prescription where they want it and not running all over town.
Sure. And just like we discussed, this is a very unique situation that we've never, had to come across before. So we're creating those things and, what does it look like in the communication when someone drops off a script or if an e-script comes through, how do we address those situations? So we have tools now that we've never had before with centralized services that are able to support in a manner that we've never been able to before. So I feel confident that we would be able to do that with minimal patient impact.
So like faxes, e-scripts, phone calls, all forwarded to whichever location's open.
So I don't know if they're necessarily forwarded, but when the store is closed, the physicians do get notified that, hey, this store that you're sending an e-script to is currently closed. So there will be some manual communication with providers, your most common providers in that town, of letting them know what the hours of operation would be. And, especially in a town like this, the one-to-one conversation is going to go a lot farther than, a form letter or an email. So we'll really rely on our team to, rely on those connections that they have with the providers to speak so that we can get their support during this, little grace period here.
Any issues?
Yeah,
with
oh, sorry.
medicines? Any issues with like controls getting sent into one store and not having been filled?
So that would be like if it's an e-script, where, the notification that the store is closed, we would rely heavily on. But once again, talking to the providers and, if we haven't really done it before, but this could be a role where centralized services supports too, if it has been filled.
Yeah, and this is Nicole Cover. The only thing that I can add here too is obviously we have a real-time database. So, from the mom perspective, the pharmacist could see by store number, oh, I do see your amoxicillin is actually at X, Y, and Z store. So we could accommodate that as well. And then it's the same thing when we close at 9 and they think we're open at 10 or, anything like that around the ERXs. We plan to do a nice thing with all of the providers to talk about how they can cancel and resend it to the other store. And I have a resident physician in our family that I've been learning from them how that works. So we have a whole process to inform and educate on how to use the tools, but at least the pharmacy can see that in a real time to be able to help the patient. It's not just, we have no idea where your prescription is. So certainly we will continue to update you on the staffing and any concerns that we have, from a patient, complaint perspective or anything, we will continue to learn from them. And then we will evolve that into a better solution or an FAQ for our teams.
Did y'all consider I guess it'd be 6 or 7 hours a day, Monday through Friday in both locations versus trying to do the 3 days here and 3 days here? It seems like it's gonna fix every other day, but it seems like it's still gonna be, well, I always go to the grocery store on Thursday, so I want to pick it up here. I don't know if a shorter work day every day.
Yeah, if you have one pharmacist, they can only be in one place.
Oh, you're
Yeah.
using pharmacist, okay.
Yeah, and then it's a vacation time. I mean, believe me, Debbie, excuse me, board member Mag, I can tell you that we've definitely taken through every scenario, but that doesn't mean we can't change it as things start to go forward and giving people their time off and, a lot of things that were already planned in the hopper, so to speak. But I think Brad and his team will do a great job of giving you that information and those updates and hopefully being able to, give the public record that we can, maybe expand and we'll certainly do that as soon as we can. I just think this is really, we've been putting our heads together and really the best option we have current day.
And so we would be approving the 30 hours. We're not saying what day and what.
Right.
when And all that kind of
Oh,
stuff.
sorry, that's not for
If
me.
They need to alter it.
Make
They need to make changes to help the people. Yeah,
Motion.
public.
Yes.
Yeah. So do you guys, this is a temporary approval, so do we want to do a temporary approval and then require an update back from them in say February or next June or? I was thinking February, but if.
Well, I just think when they hire that next person that they need to go to 40 hours. If it happens before that.
And the reason I said February is, did you say this year's class is the first one to graduate in December?
Yeah. How many is it? 35 roughly?
I don't know if anyone.
I think it's like 35.
Now, but you never know. You never know. But anyway, what do you guys think?
And if they hire somebody in that period, then it goes back to 40.
Well, I would caution, they may hire someone, but they may not have them full-time in Ashdown either. It'd be perfect if tomorrow 2 people fell in their lap and we both want to work in Ashdown, it'd be easy. From my perspective, it's very difficult to predict that because they're trying to hire both pharmacists and technicians. It's not necessarily a 1-person thing. It may be a 3-person thing.
Just say as soon as humanly possible, you make the switch back, but give us the update as Clint suggested.
In February.
In February, when you had a little bit of opportunity, I'd be hitting up Harding pretty hard.
That's not an in-person.
Yeah.
Come back down here.
And if something happens, falls from the sky and you want to update us in October, you always could. But I think February.
What's the motion again?
The motion.
What I have is give them 1 year potential approval for the temporary authorization with an update in February. And basically the message is, if at all possible, get back to normal hours before then.
Second.
Normal meaning 40 hours,
I did.
correct?
Second by Dr.
I know what John's help.
Lynn.
Kraus. Okay, if no other discussion, all those in favor? Any opposed? Okay, motion passes.
Thanks, Brad. Nice to help.
Thank you, guys.
So we are going to break for lunch until 1 o'clock. You gonna say 1:15?
1:15.
1:15 will be fine. We'll probably have some running around to prep. I'm gonna go ahead and give you guys copies of the authority to conduct oversight activities, so you can look at that. We will need a vote on it before the end of the day.
Okay.
I've got 2 other discussion topics I can give you handouts on, so you can actually read them ahead of time. And then by the end of the day, y'all need to do elections.
Okay.
Thank you.
We have 5 minutes to do elections. It won't take but a second.
I feel it.
I know.
I said, we should just do the elections right now.
You what?